will be delivered by Dr. Sarita Ulavane. Before I start, I want to introduce her briefly. She is working professor in charge at the Department of Gynecology, Mumbai Veterinary College. She has completed PhD and MPSc in animal reproduction from Bombay Veterinary College. And she has published around 100 research papers, including lead papers and technical and extension related papers. She has delivered radio talks and wrote articles in magazine. 20 students have completed post-graduation under her guidance, and 4 PhD students also guided by her. She has special interest in companion animal infertility treatment and reproductive ultrasonography. She has introduced and established ultrasonography in Maharashtra and standardized pregnancy diagnosis, pituitary ovarian scanning in different species of animals. And she had the opportunity to visit Utrecht University in the Netherlands during in 1990 for her training on small animal endoscopy. And then she has worked on modified techniques of artificial insemination in dogs with success rate of more than 85%. She has also won many awards. To name a few, these Chariot Mumbai Awards for her work on state of population control, Best Lady Veterinarian Award by ASCPA in 2010, Pathbreaker Award, and currently she is working on color doctor studies in canine and feline pregnancy and survivability of feline fetuses post-birth by Edgar scoring. With this brief introduction, I request Dr. Sarita to start her presentation. Thank you.
Respected chair of present in your campus, all the professors and senior dignitaries there, and dear students, very good morning to all. First, let me thank the organizers for giving me this opportunity to give lecture to you all and interact with you. I will try to share my PPT. I hope everybody can see this. Are you able to see the PPT? Then I will move ahead. Okay. So the topic given to me today is fertility management in canines. Before I go to the lecture, okay, so
excuse me, ma'am.
Like production animals are different. Hello.
Yes, ma'am.
So in production animals, our fertility expectations are very different from those of canines. Remember, in fertility in production animals is you want calf a year, you want milk, and so you want calf a year. That is in case of cow and buffaloes. However, whether the pet owner is a breeder or a pet parent, the expectations of fertility are different. What is the breeder perspective? Breeder's perspective is a pet parent agreeing that okay, if I can't breed this female, cull her. That culling aspect is not there because it is their own pet which they raise like a baby and they want a progeny from that particular pet. So even when the fertility is poor from that particular female or a male, they would expect us to do something for them and get the puppy from that particular female as a memory. Now, normal fertility in female dogs, 75% female bitches who are mated, they always produce offspring without any special investigation. However, this particular field has commercialized so much now. It is not like previous, 15, 20 years back when I started my practice, the male stud dog, they used to give multiple matings to a female dog without charging. They were okay with taking one puppy back. Now this field has commercialized so much. One puppy can cost you from few thousand to a lakh of rupees also. So the male dog owners are also restricting the stud services they are giving. They are charging the stud services heavily, and also they are restricting the stud services to 2 services per mating. So your fertility expectations again have changed over the years when it comes to commercial aspect of this particular industry. Now, when do breeders usually come to you or a pet parents? There's again a difference. A breeder will run to you once they know you are giving them a result for every cycle. I have breeders coming to me for every cycle asking to investigate and tell them the date of mating, because they are breeding pedigree dogs as a commercial venture. So they are taking their bitches from here to Bangalore, here to Gujarat, Mumbai to Gujarat, from Gujarat they come to Mumbai or go to Bangalore. So they will come to us for each and every cycle investigation and ask for the help. However, the pet parents, don't, they don't conceive for this particular expectation of fertility. When those pet parents or breeders will come to you, differ with economics and emotional bonds of the dogs. I hope everybody has gone through this, understood this. And so, why so less study compared to production animal? If you see research papers, most of the research papers are on large animals, but there is mainly lack of pressure. If a dog or a female dog or a male dog is infertile, many a times just neuter them and they are kept as a family pet. Also difficulties in investigation, because our animal welfare board, the experiment on dogs are not so easy to conduct. There is a lot of permissions required, so naturally there is difficulty in carrying out research because of these restrictions. You have to do a lot of paperwork for this. And third, reluctance of owners. Many a times owners who are basically they are looking at their dog as a pet. If you tell them you require excessive investigations, they say, I'm not interested in having a puppy, let it do. So these are the 3 main factors which have restricted our studies in compared to production animals. Before going to fertility management, let me just tell you briefly classification of infertility, because I am going to concentrate on fertility. You will realize many problems of infertility are taken care of if you are managing fertility optimally. So causative factors are infectious causes and non-infectious causes. Non-infectious causes, if you see, mainly I would categorize them into 4. First, wrong time of breeding in a normal estrus cycle. Every breeder, the normal pro-estrus is 9 days, estrus is 9 days, and then so on. So a normal breeder has its own calculation that I will breed my bitch on day 11 and 13. As I said, 75% dogs may conceive with all this your 10 and 13, because in standard bitch will ovulate around day 12 starting from day 1 of the proestrus. In dogs we do calculation from day of proestrus, because that is the most prominent and visible sign. Transition from proestrus to estrus has to be judged by different methods. So usually for easy calculation, proestrus starting one day is considered as a for the calculation most of the time. So starting of a pro-estrus, people start calculating, breeders most of them, and breed their bitch on 11th and 13th day, provided that bitch has a LH surge or ovulation around day 12. But if there is a variation in normal cycle, this will be missed, the bitch won't conceive. Then abnormal estrus cycle, there can be prolonged estrus, there can be short estrus, there can be long proestrus, short proestrus, silent estrus, split estrus. These abnormalities, the timing of mating, if it is done exactly like a normal cycle on 10th, 11th and 13th day or 10th and 13th day, the bitch will not conceive. Then third is failure to breed. In these bitches, the cycle may be completely normal, monitored also by various methods which I am going to describe further. However, this bitch will not stand for mating. There will be refusal for mating for various reasons which I will be enlisting further. And fourth category is conception failure in normal estrus cycle. That means everything is managed properly, ovulation is managed, mating is managed. However, the mating is proper, still the bitch will not conceive in normal estrus cycle. I will be mainly concentrating on first thing, that is wrong breeding time in normal estrus cycle. By fertility management, first two categories, that is abnormal estrus cycle and wrong breeding time in normal estrus cycle, can be eliminated. So I am going to start with that fertility management, what is important in fertility management. So this I have already said, wrong time of breeding. So I will just miss that again. See, as I said, fixed mating by the breeders. There is large and ovulation pattern, which I'll be explaining further. Then what you can do is you can do careful monitoring of vaginal cytology, hormonal assay and vaginoscopy, which I'm going to describe further. This I've already mentioned. What is silent heat? A silent heat is there are no signs of proestrus, or maybe a slight bleeding is there, and suddenly the bitch stops, goes into estrus for a very short time. Owners don't notice it, and she's out. And this bitch will be mated on day 11 and 10 or 11, 9, 11, 12, 13, whatever the breeder's calculation is. And she's not going to stand for mating because her estrus is already over. Then again, as I said, prolonged proestrus and estrus. The proestrus can be as long as day 21. So in such cases, if bitch is again mated at 9, 11, 13 day, naturally she's not going to stand for mating and she's going to refuse mating. Or if she's forcefully mated, she's not going to conceive. In prolonged estrus, the similar problem. She may accept the male, but ovulation timing is variable and you may mate her on the wrong days. There is something known as split heat in case of canines. What is split heat? In split heat, the estrus will start initially. Proestrus is over, estrus-like symptoms are shown, and suddenly the bleeding starts again. Now, usually the first estrus is anovulatory and the second estrus which is shown is ovulatory. So if these bitches are mated in first estrus, they are not going to conceive, and owner ignores the second proestrus surge, then they are going to not conceive. So let's come to now fertility management, because if your criteria of fertility management are good, whatever I'm going to explain you, then most of the time you will be able to manage all these abnormalities which I have mentioned before. Now, what is proestrus? There is a lot of difference between the proestrus. Since I understood that there is a lot of undergrad level here, I am going into depth with this rather than going hurriedly in basics of canine estrus cycle. In proestrus, there is a lot of difference between the cattle and buffalo and the proestrus in case of canines. In proestrus, you remember in canines there is proestrus, estrus, prolonged mate estrus. Some people call it as a diestrus. Mate estrus and diestrus are considered together, and there is prolonged anestrus period. So when the bitch comes from after anestrus phase, when the bitch comes into proestrus, she is. Give me a minute, I'll keep my phone on silent. Sorry, I forgot to do that. So when the bitch comes in the proestrus, The difference here is the follicular wave starts, follicular growth starts, and with increasing estrogen, there is no progesterone of previous cycle as you have in case of cattle. In case of cattle, you have a regressing corpus luteum of previous cycle which is secreting progesterone. However, there is no progesterone in particularly in bitches of previous cycle. So estrogen is rising, and with this rising estrogen, there are certain changes which happen in the bitch. There is something known as increased permeability of blood vessel under estrogenic influences, causing diapedesis, that is escape of RBCs and some fluid from these blood vessels. So the proestral bleeding is with the rising estrogen. Now this proestral bleeding, if you have observed carefully any female dog bleeding, you will observe it doesn't clot because there is no rupture. Increase permeability. This blood won't clot. Initial phases, this blood is extremely dark. It is compared to normal bleeding, watery, doesn't clot. As the estrogen rises, the edema of entire genital tract inside also, they are, remember, because I am going to talk about vaginoscopy as one of the indicators of deciding the stage of estrous cycle in bitches. So the vaginal mucous membrane also become particular bleeding secretes she is still not in proper estrus because there is no progesterone of previous cycle. So for a behavioral estrus, you require previous cycles progesterone. So there is no progesterone. So this particular bitch will refuse mating. However, she will be attracting. She will as a marking behavior. So may for mating. How does estrus? Now, as the typical phenomenon in case of dogs, use as a foliated vagina. As the proestrus, the estrogen is rising. Typical phenomenon in case of dogs. What happens? Surge, that is transition from actual estrus starts rising, and this progesterone, a small amount, not talking about the ovulatory, this small causes shift estrogen to progesterone. There is sharp, remember, there is the estrus starts, progesterone starts rising. Now this small decrease of LH causes luteinization of follicles before the ovulation, and then the further LH surge will happen. So this small shift from estrogen to progesterone influence, that is increase in progesterone, will induce the estrus. Here the behavioral estrus will start. What will happen? The bitch will start standing for mating. If in absence of male, how you can judge this? If you tickle the bitch on the perineal region, there will be something known as tail deflection. Remember that this is not LH surge or ovulation. This is 2 days before the LH surge. The 2 to 3 days before. So tail deflection will be shown. The vaginal tumification will slightly reduce. So this, there will be slight wrinkling of vulva. It is very, very minute, and you need experience to observe this. If you do mucous membrane examination, the edema also slightly reduces, the RBC also reduce in the discharge, and the discharge from dark bloody red color will become pinkish straw color. So this is transition. So there is behavioral change in the estrus, I mean from proestrus to estrus in a bitch by shown by certain tail deflection, then vulval winking. I mean, you know, when you touch the perineal region, the vulva will contract slightly. It's not like mare, not that prominent, but slight observation. If your observation are good, you will see then edema will slightly reduce, and the discharge will also turn from dark red to pinkish color, and there will be acceptance of male. This I'm assuming that the bitch is behaviorally receptive, though some bitches still refuse to breed because of psychological issues that I will come to later. So most of the from proestrus to estrus by behavioral symptoms, rely on behavioral symptoms 100%. They come to you for not management but infertility, will have problems, so they are coming to you. So this, you may expect the cases presented to you may not show this behavioral change. Some show the behavioral change. Now, as the estrus continues, there is LH surge. The mate estrus. Speaking, the mate estrus will be still difference in which from the male acceptance period from ovulation can be -5 days to +5 days. So, sorry, from LH surge -5 days. So you only consider the LH surge as a point of calculation. Remember that, because that is the only standard point. You cannot consider proestrus day, estrus day as your starting point, because proestrus to estrus transition is not so demarcated by any method. 100% no. But LH surge can be identified by various methods. So the LH surge is considered as a center point. Even the station LH surge. This is typical presentation. I will not go into this. K0, that is LH surge, right? So as I told you, this is what we do the monitoring with tastings. You can see here the attractiveness has started way before LH surge and continued after LH surge, right? So this is, sorry, this is day of ovulation, this is day of LH surge. So the way before the attractivity has also started before and has continued after ovulation. Here you can see day to breed is surge. You can do the first mating and second mating can be done. So if you have only 2 matings, so usually my practice is I monitor the LH surge close to LH surge and second after the ovulation. So fertility. In case of canines, I will come to that. If you make them very late, you are likely to get the. So after ovulation, the ovum are fertilizable for quite few days. 2 days and 3 days. But if somebody misses the ovulation, which accepting ovulation, ova will be fertilizable is going to be smaller. So if you want a best increase fertility of a bitch, then you should mate the bitch within the time frame which is shown above, that is late surge and one meeting after the ovulation. Then early pregnancy arranged 30 days and days from ovulation. That is what I usually would go for my first ultrasound between 40 to 50, whether the fetus is properly or not, whether the fetus skeletons are visible or not, how is the growth, and also to enhance my prediction of parturition and fetal age. Day 40 related ultrasound. Both to predict your parturition with a good success. Ideal way to describe parturition is LH 65 days, and from ovulation it is 63 days. Always remember 1 day minus plus. But if you have monitored ovulation and LH surge, these are 50 and days plus minus 1. You about the fetus. In ovulation is very being said most of us should start will before the most of the time before the elixir the extra symptom starts and symptoms. But you cannot always that I'm considering this as a standard cycle. If there is some variation, there will be changes. Start of proestrus to ovulation, maximum witches will ovulate between 9 to 14 days post starting of the proestrus. If you consider day 0 of proestrus. However, the variation is day 5 to 25, sometimes even 30. So, there is a lot of variation. And as I said, the bitches who come to you will be those 25% who have problem. So consider, you should keep this in mind, but every bitch comes to you, don't go by this standard calculation. LH surge and ovulation, what is the correlation? It is 36 to 48 hours post LH surge, ovulation can happen. That is maximum ovulation, but few ova can even release later. Those are the ovas which will be ready for fertilization even around day 5, and that's why you will get a single fetus or sometimes two fetuses causing future issues, which is known as single fetal syndrome. I have not covered this here, but smaller litter of one is always an issue when it comes to canines for parturition. They are likely to go for a primary uterine inertia. Maturity of ovum. In case of canine, the next difference than cattle is the canine ovum is released as an immature ova. It has to undergo one maturation division and release of second polar body before it is ready for fertilization. So after LH surge, calculate 2 days for ovulation, then 1 or 2 days for maturation, and then so you have early for after. So if you go on Easter starting, you will hit sometime a proper time because the life of sperm is also long in case of canine. The life of sperm, average life is 5-7 days. Life of ovum is again long, 2 is again long. Days. Case which proestrus may be live because the life of sperm is 5 to 7 days. It is likely that she in estrus, but only thing the litter size will be smaller. If you are mated which two, what will gestation will be prolonged. Why? Because our calculations are from LH search. You've seen this. But my calculations are from ovulation. And you will consider, oh my God, this is prolonged gestation. I need to operate this dog. No. Help naturally on her time, but your calculation are wrong because you have not monitored the ovulation or LH surge. So that is why it is important to understand the basic physiology when we consider the canine and how different it is from the our production animals. Sir, when if I am exceeding time, please let me know. It is up to 10:30, no? Hello. Okay. So let's see which what are the different landmarks. This I have of what I spoke. So fertile period is a period when the bitch is accepting the male dog, can start 5 days before ovulation and ovulation. This is the fertilization period. The best fertilization period is 2 days after ovulation when ovum is mature. The life of ovum is 3 days. Fertility, peak acceptance, peak acceptance. Acceptance is before also, but maximum acceptance is from -1 day, that is near LH surge, to +4 days, that is after the ovulation. For natural service, we prefer day 0, that is very on the day of ovulation. I usually, because you may miss the day of ovulation, if I have monitored the LH surge, I usually tell them to make the bitch how it is very. It can take place hours again on day +3 or +4. AI, the same period. Period be very close to ovulation because if you are using frozen semen, go as close to possible as ovulation. So +2 or +4 days. So how do you start judging the timing of ovulation in case of bitches? You need to take why it is important. Some bitches are on medication, thyroid on steroid issues. They are on fungal infections, so they are fertility very common. So when hemoglobin is low and they are under treatment of doxycycline, you should not be mating the dog. When hemoglobin is low, you can have a less fertility. So taking general health history becomes very, very important. I cannot cover everything, but just uh, general health history. The bitch should be perfectly healthy. There should be deworming, vaccination in time. It's also important to the bitch needs to be dewormed in proestrus so that because there is transuterine, transplacental transfer of eggs of worms, so you need to deworm the bitch also previous to mating her. Then go for the specific genital tract related history. Now, what is specific history? Past estrus cycles. Whether she had a prolonged proestrus or prolonged estrus or a short estrus or a silent estrus in gives you some idea what to expect in estrus which are going to monitor. So take the history of the past estrus cycles. If there were any matings, whether those matings had failed, plus first whether the matings had already matings took place when the bitch was in standing estrus or mouth was tried and tied and the pores becomes very important in specifically in bitches which are infertile, because many a times the calculation wise the matings are done and bitch is really not ready and they tie the mouth and mate the bitch. Such bitches in future will develop a behavioral issues and will not stand for mating even when you have monitored the estrus. So you monitor the estrus, they spend the money on cytology, hormonal assay, and take the bitch for mating. She won't stand for mating because the previous force mating history is there in mind. So you must warn these owners that this bitch may not stand for mating and may require artificial insemination. If there were previous pregnancies, whether there were any abortions or premature births, so history of previous pregnancies is also important. That tells you if there was any infectious cause. I can't cover everything, but just to tell you okay, what kind of history will be required. So whether there was any infectious causes involved in previous abortions or premature births. Then next is your present estrus cycle. Now then your job starts with the present estrus cycle. Now in present estrus cycle, what are the different tests you will do for fertility management? First, you start with a physical examination. Now, first is general examination of a bitch. What is general examination? You check the mucous membrane, respiratory rate, temperature. This is very important because if general health of a bitch is not good, please, please, please don't mate the dog. Tell the dog owners to improve the general health, do the blood test, do general examination, carry out, then next cycle you can breed the dog. But if the general health of animal is not good, please don't breed because puppies will be weak. She may not remain pregnant by spending so much money on the examination, and on top of it the puppies may come out weak. Also the abortion chances will be higher. So if the dog has ticks, please just take care, because if she develops a tick fever during pregnancy, her life will be in danger. The placental sites will bleed excessively and even the uterine bleed can cause death. So examination first and then product. In my reproductive tract examination, I don't go directly for vulva and vaginal examination. I just observe the dog from backside. When I observe the bitch, I would see the placement of vulva. This part I have not covered completely because it's too long a lecture, then not I can't cover that. But remember, if the vulva placement is wrong, if it is too low, if this is a rectum and vulva is here, that is a normal placement. But vulva some, so this vulvovaginal vestibule is very long. So such bitches may not have a natural mating because the male dog may not be able to carry out intromission, that is in the vaginal passage very easily. So if the placement of vulva is bad, you can warn the owner that this bitch may have problem in natural mating. This could be one of the causes of previous failures also in natural mating. Then next is I observe the vulval edema, whether vulva is edematous. If it is huge edema, you ask the owner whether the edema has reduced in size. That will give you indication that the estrogen influence has slightly gone down and the progesterone influence is increasing. That is known as softening of vulva. If softening of vulva is not there, maybe the bitch is still in late proestrus because the estrogen influence is still very high. Then I open the vulva, see the discharges. If discharges are dark red, that also indicates that the bitch is still in proestrus. So discharge color also, that is the second thing you notice. Then next thing in physical examination, I will tickle the perineal region and check for flanking of tail. The bitch will take the tail on the side and open the vulva so that the mating can happen. This is indication that estrus has started. However, this can start 3 days before the LH surge, as I have mentioned. So it may not have direct impact on identifying LH surge, but that will tell me at least the estrus has started. Remember, behavioral estrus in each and every bitch. So there is likely some bitches are examined when they are on examination. Owners to go home and check the tail flanking. The next thing I do examination. In per vaginal examination, you can use a gloved finger, take some gel and check for patent. When you open the vulva, you have multiple things you can see. Some bitches have prominent clitoris, or they have even the os penis in the clitoris. Now, this os penis in the clitoris, or sometimes they have narrowing of vulva. The edema is there, but the slit opening of vulva is very tiny. So, in such cases, you will find natural mating may not take place. Once you do per vaginal examination, if vulvovaginal vestibule has a tight cingulum, cingulum is a part, sphincter-like part, which contracts on bulbous glandis during natural mating and causes lock because the bulbous glanding swells because of this constriction. So if this is very tight, then in per vaginal examination, you may have resistance. Some bitches also, so these bitches also will refuse to stand for natural mating. Then, if you are able to pass your finger further, what you check? You will check any hymen-like structure or any obstruction in the vagina which can prevent natural mating. Also, during your, if you develop your techniques well, your fingers can take a judgment on vaginal mucous membrane. I mentioned previously during vaginal mucous membrane have undergone edema, they are enlarged in size, and as the estrogenic influence reduces and progesterone starts increasing, the edema reduces. The edema reduction in edema causes shrinkage of the vaginal mucous membrane, which can that also indicates that proestrus is ending and estrus is starting. So in a small, this particular examination, much detail that nothing by the female from vulva and doing per vaginal examination. To note down all this before you go further to further tests. Now, what are the diagnostic tests which we go further? The further we diagnostic tests we carry out are vaginal smears, hormonal assay, and vaginoscopy. Each have their merits and demerits. Vaginal smears, most easy. Anybody can do it. You need a slide. You need a something to take this a thing or a long that culture cut you which you take for swab, which you take that you need, and a stain and a microscope. So anybody can do it. However, it has its own drawbacks. Only on vaginal smear, you can just say the proestrus has shifted to estrus. And make estrus at ovulation exactly cannot be judged exactly on vaginal smear. Vaginal smear can indicate, how it can indicate, I will describe that, but it cannot 100% give you timing of LH surge and ovulation, which is very important to decide the time of mating when it comes to very highly pedigreed female dogs who pay a lot of money for one stud service. Also, if you know LH surge and ovulation, you will exactly know when to expect the parturition, as I said previously. So for that, vaginal smear may not be useful. For that, you will have to go for a hormonal assay. However, the cost of vaginal smear is very less. If you continuously do hormonal assay without doing vaginal smear, you will have to do hormonal assay, or at least first initially before the estrus begins, maybe every 48 hours. So the costing, plus it is invasive technique, you need a or ELISA or a chemoilluminance assay. So these specialized lab requirements do not always available to everybody. The cost increases. So I further I will start with the hormonal assay. And last is vaginoscopy. One smear, we will talk about this in detail. Is a I told you by finger judgment, the edema and shrinkage can be very clearly seen on vaginoscopy, and hormonal assay correlate very well. Again, it is an expensive technique, may not be afforded by everybody because it you can only do on vaginal smear and hormonal assay a very good job without even vaginoscopy. Now, how do you take a vaginal smear? Because I understand a lot of UG students are there, I have taken in detail this. The vaginal smear, remember this is exfoliated vaginal cytology. What is exfoliated? The cells which are shaded. Vaginal mucous membrane, you are going to take a deeper layer. So rather than taking that, you just have to touch the vaginal mucous membrane with your earbud kind of thing, which is supposed to be very long. You are supposed to take a longer earbud or a swab, which is taken for the best results are obtained by cranial vagina. Behind the posterior part of vagina may have the from the previous few days also. So the more cranial you go, you are more latest results of the cytology. So go to the cranial vagina and only touch the mucous membrane. Don't scrape the mucous membrane. After doing that, you prepare a smear like any other smear by rolling on the slide. You roll this particular bud on the slide, and then you can do the staining. You can do Leishman, you can do right Ginsa stain, that is known as diffuse stain. So both stains can be done. So usually I use Leishman or diffuse stain. You can see the what types of cells you expect. You will expect intermediate cells. They are hexagonal with large nucleus. You can expect parabasal cells. Those are round cells with prominent round nucleus, round, perfectly round cell. Then you expect neutrophils. These are the intermediate cells. These intermediate cells undergo cornification under influence of estrogen. At these cornification, when they undergo cornification, the nucleus becomes pycnotic, and they change their shape, and at end of it, the nucleus disappears. So you get fully cornified nuclear cells. Okay. So these are the cell types you will see in your vaginal smear. In proestrus, early proestrus, you will have only intermediate cells with lot of RBCs. As the proestrus starts changing to estrus, the intermediate cells start getting cornified. You can see they have changed their shape. The nucleus, some becoming pycnotic. The number of RBC and WBC starts decreasing. The background is also becoming better. It's becoming more clearer. As the peak estrus comes under influence of estrogen, almost more than 75% cells undergo cornification because separating. Some cells may have nucleus, but it's still pycnotic nucleus. You can see in few cells. They cornification. Where the variation starts. Some bitches after 60% variation, cornification may not show further cornification so rapidly. Some bitches show 75 to 80% cornification. So if there is LH surge, we will not be able to pinpoint LH surge only on cornification, because cornification is only indication of estrogenic influence, not the progesterone influence. To the LH surge, there are certain criteria which you can use. Usually the when the influence is very high and changing to progesterone influence, the background becomes very clear. You can see here the background is very clear. There is hardly any bacteria, RBC, WBCs. So these are the usual post your or this time that tell you LX time or progesterone, that we'll discuss later. But you can start your hormonal assay here. First, you can take the sample. It is known that every 48 hours the volume, the amount of progesterone, it may not be 100%. So today it is 0.5, maybe after 2 days and after. So I'm not 100%. 48 hours. Now this is metistus. Here so there is your neutrophils. So this is how the metistus becomes a very important point. If anybody can identify on vaginal smear the first day of metistus, which is also coincides with fertilization day, because remember metistus in dogs, acceptance of male is still there. Ovulation has a, the ovum is still live. So this can be, but you have to identify the day 1 of metistus when you start getting parabasal cells back into smear, which may be difficult, may not be always possible when it is a clinical setup, because owners compliance, they have to come to you every alternate day to check this. You have to depend on nurse combined with, because coming from, you can it comes to their own in their blood and send it to lab, the result what their traffic time, you cannot tell them to basically. So you have to take your call whether you want to go on, but I usually combine smear with the progesterone assay. So this is cytology stages, what to expect. Anestrus, the hormone of influence is prolactin. You will have parabasal cells, small intermediate and leukocytes. I will go fast because it's already 10:30. Proestrus, estrogen, LH. I will. What are the hormonal assay possible? Very, it doesn't have surge, and it is hormone LH. Yes, to be identified on smear, which is may not be possible. You may miss blood sampling maybe twice every 12 hours to identify LH surge, and also estimation may not be possible in human labs, may not. However, every human labs, big human labs have a progesterone estimation. Progesterone is reliable for the canine progesterone. I have been doing it for years. There is, and I have done a canine as a specific and compared them. There is hardly much difference. Progesterone ranges are very high. So even if there is slight variation from labs are using either and you get results in 4-5 hours by ELISA or immunocumulants. So no need to wait also. Here is cost. It is in very good thing. So I have already this. There is LH of the causing rise in progesterone. Also very high increase till and that
નિલેશ દોસ્ત આને કાંઈક થોડું ગરમ કરને ઠંડુ થઈ ગયું કોઈ હવે તમે નીકળી ગયા આ પછી આ
Sir, I can't hear you.
Okay, madam. Hello. Hello.
Hello. Repeat.
Hello, madam.
Hear you.
Your voice is not audible. Please wait for some time.
This is visible. You can hear me?
Yes.
Yes,
I can
yes.
hear you, madam. Please.
Sir, do I have a time? Because I think I'm already exceeding the time.
Okay.
Should I continue 5 minutes? May finish every just
Yes,
5
Yes, ma'am, please.
minutes. I say.
Madam, screen, please. Madam, share your screen. Hello, madam.
Sir,
Yes, it is visible now.
can you hear me?
Yes.
Yes.
Put in
Sir, I'll
PowerPoint mode, madam.
finish.
PowerPoint mode.
5 minutes में ये 2 स्लाइड दिखा के I'll just finish.
Okay.
Vaginoscopy briefly. Okay. So, see, what do you expect in progesterone concentration? The progesterone should be per ml at a pre-ovulatory LH surge, which will increase almost double, 5 to 10 nanogram per ml at the time of ovulation, and it will become 10 to 25 nanogram per ml during fertile period. Now, these are very different figures from what you will see in large animals. So, this is quantitative ELISA, which is semi-quantitative ELISA. Quantitative ELISA and so it you very less, and though she is in fertile period, that is between 10 you will 10. So for for exact idea. So that is the if you are doing serial monitoring, then serial good, but this is I mentioned to you already. See whether the vaginal mucus edematous, you can see edematous mucous membrane. You can also see this is start of estrus. Progesterone influence has already started. You can see the crenulation happening, the edema. This is fertilization period. This is early. This 2 days later, you see complete crenulation and estrogen influence is least and progesterone is highest. I think I will stop here. I was to take ultrasound of ovary and all that, but I think that is not important. For fertility management, even if you do cytology, physical examination, cytology, and progesterone hormone, combining these 3 techniques, most of the fertility problems in witches can be managed. So let me end my lecture here with this conclusion. Thank you all. Hello.
Thank you, madam.
Thank you, madam.
Sir, should I shut down my video and screen sharing? Screen sharing I already stopped.
We have, madam, 2-3 questions for you.
Okay. Okay, sir.
First of all, thank you for your wonderful lecture on fertility management in canines. So there were some audio glitches, but it was very informative. So first question was, is there any study on C-reactive protein in pregnancy diagnosis in female dog?
Sir, hai, but they are not practical. You have such a good method of ultrasound. Why do you need any other method? Because research is different, but practical thing, ultrasound gives you best method. So you don't have to do other methods.
Okay, thank you, madam. Another question is, what is the treatment for anestrus in female dog?
What is the treatment for?
Anestrus in female dog.
Okay, anestrus, you have to identify the cause. It's a big topic by itself. Many times anestrus is unobserved estrus. It is not really anestrus. Owners have not observed it. So unobserved estrus, because there might be silent estrus. There is, then you have to see the nutrition, which is the most important thing. There could be mineral deficiency, protein deficiency, in female dogs. Some female dogs are only fed on vegetarian diets, which may be very low in protein. They are canines, and if you don't give them the protein, required protein, then also they can go into anestrus. Then there is thyroid problems or adrenal corticosteroids can be high. That can also lead to anestrus. So you need a complete evaluation of all the systems. Start with unobserved estrus because that is the most common. Second is nutrition and thyroid, because thyroid is very common in dogs compared to other species. Very common thyroid problems. So latest, we have getting almost all labs golden retrievers with thyroid issues. So eliminate thyroid, nutrition, unobserved estrus, and then go for advanced tests or induction. Induction, you can use cabergoline, which is anti-prolactin method right now available. That is used. People are using the
Madam, your voice is not audible. Hello? You are not audible.
Good morning, Dr. Madan.
I think you have elaborated a lot.
Pleasure in seeing you, Sarita, and making this presentation.
Since there is some connectivity and problem and interruption, if there are no questions,
Sarita, I wanted to know from you about this endocrinology with respect to pseudo pregnancy and pregnancy. How will you distinguish on the basis of hormones since you are having this profiles, endocrine profiles, that in terms of pseudo pregnancy, maybe at about 28 or 30 days of pregnancy, suppose pregnancy.
Sir, can you just put the question online? Because I'm not properly.
Do you get what I wanted to convey?
Pregnancy diagnosis, but it wasn't exactly I understood.
Firstly, I wanted to convey pleasure in seeing you.
Thank you, sir.
That was the first.
Same here, sir. Yes.
Second was with respect to the pseudo pregnancy,
Okay.
endocrinology with respect to pseudo pregnancy. Particularly since you showed some figures of progesterone, I've got a little concerned about those figures because the levels are too high at the time of ovulation. If they are so high that I don't think that the uterus will get sufficiently prepared for the nidation, or the ovulation will occur in the first instance.
The progesterone is very
At the time of ovulation,
same in pseudo-pregnant dogs, and even
at the time of ovulation, you showed
time of ovulation, the
progesterone levels.
Yeah, very high.
That's
5 to
right.
10 none.
Yeah, if they are so high that the ovulation at that time, you see, it will get inhibited. That's what I'm saying. That ovulation time, it should be around 1.2 to 2 nanograms, around that.
Yes, 4 to
So
4 to 10 nanograms.
the high levels, so high levels are not indicative of ovulation. As a matter of fact, that there will be no ovulation at that time. That's my thought. That's I don't know whether I have understood properly or not.
Ovulation, the levels are very high.
And then I wanted to relate it with your pseudo pregnancy, because if you have a female is pseudo pregnant.
Every female dog, irrespective whether she's mated or non-mated, pseudo pregnancy is there in each and every.
Firstly, you have kept your screen half. I can't see your face.
So,
yeah.
Yeah, actually there was. I hope the voice is audible. I'm not sure the voice is audible right now.
Okay. Thank you. And thank you, Madan sir.
Yes.
So I take this opportunity to thank Sarita ma'am on behalf of Principal and Dean Dr. Tak sir, other panelists, and Junagadh Veterinary College and Junagadh Agriculture University. Thank you for your informative lecture. Thank you very much.
Good morning, everybody. Good morning, Madan sir. Hi, Sarita.
Yeah, hi.
Thank you for sharing all your day in, day out practical experiences. I really am happy to see you. And I believe I stand with the question of Professor Madan with the same concern of the progesterone. Well, I think since it's close, Honorable Dean has closed, so I think I'll refrain going ahead with that. But anyway, thank you so much. Good to see you.
Connectivity.
Sir, good morning, sir. You are Madan, sir. Good morning.
Good morning to you, Taru.
How are you, sir?
I'm good. I'm very good.
I missed you.
I'm sorry. I'm sorry. I'm so sorry that I couldn't be on that day because I had that day, the same time, there was another lecture which I was supposed to be involved in.
Yeah.
And I was speaking to people in Assam at that time.
I understand.
So I'm so sorry the time clashed, so I couldn't listen
Not
to you.
at all,
But
sir.
I'm told that Arun has said that it is it's in the YouTube. So I will avail the opportunity of listening
Uh,
to you.
yeah, so that will be very nice. I believe what I was happy, sir, that of course I missed you personally as well and professionally as well. But people were very enthusiastic. There were a huge number of questions, and I think they
Good,
poured
good,
their affection, professionalism, and all
good,
that. So it was all
good.
thanks to
Junagadh
the.
people are doing a very good job. Arun, you
Yes,
are doing a good
indeed.
job.
Indeed, sir. Congratulations to Dean sir once again.
Okay,
Sarita, my good friend, so I was listening. Sir, Madan
Yes.
sir, we were together working in NDDB at Mumbai.
thank you,
So,
madam.
Myself and Taru were working together for
Madam, I am sorry. Madam, second speaker is waiting. I am sorry.
okay. Please go
okay,
ahead.
yes, yes,
Please go ahead.
yes, sir, yes. Okay.
So, before we go for the second lecture, respected Tak sir, Principal and Dean, Veterinary College, JU Junagadh, and I welcome other panelists, Dr. M.L. Madan, Dr. Javed Khan, Dr. B.N. Sutar, who is next speaker, Dr. Dilip Swain, Dr. M.T. Panchal, and Dr. J. Taru Sharma to the second lecture. And our second speaker is Dr. B.N. Sutar, currently working as a professor in head Department of Veterinary Gynecology and Obstetrics, College of Veterinary Science, Sardar Kushinagar Datiwada Agriculture University, Gujarat. He graduated from the same college in the 1986, and he started his career as veterinary officer in erstwhile Gujarat Agricultural University. And I remember he is my teacher and a very good gynecologist. So he also has credit of winning this Best Teacher Award. He guided 23 postgraduate students and one PhD scholar, 82 research papers in national and international scientific journals to his credit. And he wrote many articles which is useful to farmers in vernacular language and delivered various TV and radio talks. He also has designed, he and his team designed certificate course on artificial insemination. And he worked in university, he served in university on various capacities as Dean of College of Dairy Technology and College of Food Technology, SDAU Sardar Kushinagar. And he has organized refresher training for AI workers, paravets, and veterinarians. With this brief introduction, on behalf of Veterinary College and Junagadh Agriculture University, I welcome and request you to, sir, to start your lecture on immunocontraception in canines. Now, floor is yours, sir. Thank you.
Thank you, Dr. Trasadia. Thank you very much.
Before you start, one prominent point of your career has not been precipitated. Dr. Suthar happens to be the former associate research scientist at Junagadh Agricultural University in cattle breeding farm.
Yes,
And
sir. Yes,
today
sir.
he is a speaker for the event organized by a college which has born from the womb of the cattle breeding farm. So he too has a connectivity way or other to this most western corner of the Gujarat and India too.
Thank you,
Please,
sir.
please, Suthar Sahib, continue, please.
Thank you very much, sir.
Wanted
Namaskar.
to establish your love and connectivity with the Junagadh. That is why this narration was mandatory.
Thank you so
Thank
much
you.
for telling us. And it's very good that we'll be hearing Professor Sutar.
Thank you. Namaskar, Madan sir. And good morning to our the Dean of the Junagadh Veterinary College, Dr. Tang, Dr. Wala, Dr. Transadia, the panelist, Dr. Jadhav, Dr. Sarita Madam, Dr. Panchal, and all participants. Today, I have been given the chance to speak on the aspects which is less known to the veterinary sections, or it is less known in veterinary, the immunocontraceptions. The much work has already had been mentioned by earlier our Madan sir also that during the last 3 decades only, the much of the interest evoked in the immunocontraceptions or the immunological aspects of infertility. So I have to speak on the newer concepts or newer aspects. So, sir, I would like to tell one thing, that I was told that these training are basically for the PG and UG students. So I have prepared my lecture as per the PG and UG students, and here I will discuss about the fundamental concepts of intraception in animals. Sir, before we go further, we shall first see what is the contraceptions. Dear friends, you know that the contraception means it's an intentional prevention of pregnancy. It's a intentional prevention of pregnancy, even after mating by a successful fertile male. Hello?
Excuse me, sir. Please share your screen.
Screen has been already shared, sir. Your screen sharing, yes, sir.
Slides are not there. Slides are not there.
Yeah, we have shared our screen, sir. You are sharing your screen. I am getting that here. You are sharing your screen.
Sir, you have to open up your PowerPoint actually.
Yeah, yes, that is what is sharing. What is the sharing?
PowerPoint, it is not visible here.
Sir, we have opened it, and here you are screen sharing. It's the what we have received here live.
Sir, your tab is visible here. Please again go into the slide sharing and open the PPT rather than.
Sorry, karo bhai. Okay, we are doing it again. Okay. Stop sharing कर दे पहला. हाँ.
Okay.
Now you are seeing very broadly.
Is it visible, sir?
Yes, sir. Now it is visible, sir. Please.
Thank you, sir. So I will start with the what is contraception. That is the intentional prevention of pregnancy after the mating by a fertile male. That can be prevented. That is what is contraception. And the contraception word is not a new for anyone, because the government has a lot of advertisement on everyone, on every our dispensaries and even first aid centers also, that use this for the contraception. Earlier they have used as a copper T, the intrauterine device, as a contraceptives. Now they have shifted to the tablets, and many methods are there. To interrupt the pregnancy. You can say go for the intrauterine device, or different types of barriers are there. The condoms or some diaphragms are there. Spermicidal chemicals are there. Use of certain drugs or hormones are there. And lastly, for a permanent contraception, surgical procedures. That is the all different types of the methods. Nothing came. Okay. Now we can see that, in short, the surgical approaches and the okay, I will take a few 1 second only. That's all. Final. Now the different method like surgical approach, then the hormonal approach, then the barriers are there. Even though with that much of this the contraceptions, the population control was not there, and because of there certain inconveniences, certain disadvantages were there, and that's why there was need that some different types of the contraception should be developed. The disadvantage associated with all these procedures were the daily dosing of the drugs, then irritations by the chemicals they were using, then adverse effects due to long-term use of steroids, and we know the risk associated with the surgical procedure. All these had led that some other permanent methods, some methods where they have not to go for the earlier any activity, and then when the concept is maintained, that is contraception is maintained, and that's why the newer methods needed to be explored. One of them is the immunocontraceptions. Now, another question immediately arises in our mind is that why contraception is necessary. We are very clear that in human beings, the contraception are needed for the control the population explosions. Rapidly, the global population increase rapidly, and the root for all the problems like unemployment or many other social problems are in the explosions of the of the populations only. that needs some family planning is provided for the control of this global explosions of the populations. Even though various methods are there, as we have discussed, sir, but unwanted pregnancy and elective abortions are still there. Ample numbers of the unwanted pregnancies are there which need the elective abortions. And that is again affecting the public health issues of the female. Hence, there was an urgent need that some another contraceptives to be developed, even in we are talking about in human beings. Okay, sir. This was a case for the medical science. But why we need contraceptions in veterinary? That is a big question. Everyone needs that because our main objective is to improve to increase the production. Of course, we need the increasing of the production. However, there are certain factors where the contraception is also required in veterinary. One of them is to control the unchecked reproductions of stray dogs and pet dogs. The unowned dogs they are getting flare up in the population, and how to control them. You cannot euthanize them because many debuts are there which prevent them slaughtering and everything. So you need to check this one, and by checking that, we will also check the control of this of the spread of the zoonotic diseases. Now, take for example, the more populations of any animals will lead to the spread of the some zoonotic animals. We are very aware that the AIDS, the root is animal, monkey. The Zika come from animals. And if we talk in a present situation, COVID is suspected that it has also come from the animal. Why this? Because of the large populations of these animals or these different types of these animals, they will come in much of the contact with the human beings, and that will lead to the spread of a disease in the human beings. To control the spread of the zoonotic disease also, we need contraceptions in animals. Now, to avoid the incidence of memory tumor, that is only related to the population of the dog. To control the populations and certain wild animals, when their wild animals population increase, they create the conflicts between the wild animals and human interest. The very citing example for this is the if in our area, in respect to our area, if we talk the blue bull, the populations of the blue bull increasing, which is destroying the crops of the farmers. That is very important. That you cannot kill them. Debuts are there. You cannot kill them. So some types of the methods is required where the populations of such animal can be controlled. Again, another example is in the Gir forest. The animals, if uncontrolled, we know that they come into this residential areas. Of course, the reason for why they are coming in residential area is not the overpopulation. There the reason is different. But when this happens much more, they will result into the interest. They will interfere in the interest of the residential people. That's why the contraception is required in veterinary also. In United States, sir, the Baser which are the carrier for the bovine tuberculosis. They have explored like anything, and they were responsible for the spread of bovine tuberculosis. Looking all these conditions, sir, we also need to think about the contraception in veterinary, and we need a certain special types of the veterinary contraception. We do not go to each and every animals every day. We could not go for the barrier. We could not handle them daily. We could not go for to take the risk of the anesthesia and surgical procedures after post-surgical care and everything. So we need certain contraceptions which remains for a longer periods. A single dose is sufficient. No need to handle the animals frequently. These are the conditions where one should go for these contraceptions, and where the immunocontraceptions will fit the best. Of course, the research in this is under progress. We will discuss whatever I have gathered from the literature. We will see that one. Now, if we talk about the populations, then problem of explosions of dog populations. If one dog is there, in 1 year, it will produce 16 offspring. In second year, total will be 128. One survey is there. that by the end of 6 years, if it remain uncontrolled, the total population, a single dog will produce 67,000 offspring over the 6 years. That's why there is a need to control the populations of the dog. One survey was carried out in 213. Then, and they have predicted that by 2023, the total dog populations will become 31.43 millions. Now in 2014, it was 12,100.58 millions, which reached to 21.42 millions in 2019 and expected to reach at 31.4 millions in by 2023. This is the scenario. We want to prevent this. We want to check this. That is why these contraceptions are required. The uncontrolled growth of a dog population can have a negative impacts on the, we know that on public health, and can create the socio-economic, political and animal welfare problems. The disease transmitted to human and livestock, as we have discussed already, then predations on livestock, bites, road traffic accidents, and nuisance such as barking and soiling of the park and recreation areas. These are all this, we can say that associated disadvantage of this explosive populations or negative impact on the populations of the animal if the animal population increase. If we talk about zoonosis, the one report said that 75% to 99% of the rabies is transmitted to human, and canine mediated rabies kills about 30,000 to 60,000 people annually worldwide. This is a really alarming situation that something should be done to control these types of the nuisance in the populations. Now, after looking all this one, we have now clear that we need contraception in veterinary. Our need for contraception is different. Our contraception should be different than the available in the human. What should be the characteristics of an ideal contraception? One is it should be acceptability of the user. User should be, it should be acceptable by user. You have not to fix some device, something like that, wherever it will get, the animal will get in comfort. That should not be the way. It should be a comfortable for the animal wherever it is going. It should not be a hindrance in its normal activity. That is one thing. Another thing is, because of this, contraception is natural loss, natural feeling should not lost. Because if the natural feelings are lost, certain problem associated with this will arise. It should have a no side effects. It is very important that it should have a no side effects. The vaccine that is prepared has a, see, one thing very, very important, that in 1950 in USA, the polio vaccine, something goes wrong, and it has adversely affected about 2,000 people. Out of them, 200 people develop the paralysis permanently. Such types of should not be there. It should be properly tested. That should be a completely safe. Then it should be relatively non-expensive. It's not like that it cost very high. To go for such contraception, you will need a more cost than the animal cost. Should become a relatively inexpensive. It should be effective. It should control the population. It should control the reproductions. It should control the further adding of the offspring in the populations. It should be easy to use. It should be, we have discussed, no one will go and directly daily will feed these wild animals or this any animal for this contraception. It should be used, easy to use once and forget it. That should be the characteristic of ideal contraceptive. And one very important thing is it should be reversible. If we think that populations has goes quite down, and we need that there should be again some increase in the population should be there. So in that case, the effect should be reversible, nullified. That is all characteristic of an ideal contraceptives. Now, contraceptive choices available for male are all these. That is the vasectomy, intratesticular injections of chemicals or barriers. Whereas in case of the female, oral contraceptive pills, injectable contraceptives, implants, barrier, surgical sterilizations, these all are there. because we have discussed the disadvantage of all these contraceptives. In under that light, a novel contraceptive approach that is gaining substantial attention is immunocontraception. Now, immunocontraception will be possible by the use of contraceptive vaccine. It is contraceptive vaccine series. It is used to prevent the fertilizations. Now, if we go for a just what is contraception, immunocontra, now not the contraception, now our word become more specific. What is immunocontraception? In case of the immunocontraception, the body's natural defense mechanism, natural defense mechanism is used to provide the protections upon against the unplanned pregnancy. Unplanned pregnancy. That is the basic conditions of any immunological aspect. There, the body natural defense mechanism is used for the protections of against unplanned pregnancy. But the difference here is we are using the non-pathogenic immune response. We are having the non-pathogenic immune response to compensate the reproductive process. The productions of a timed, productions of a controlled and time-limited and non-pathogenic immune response to compensate the reproductive process, that is immunocontraceptions. Now, immunocontraceptions against an antigen is important to that antigen should be important for the reproductive function, and the immune response generated against that will suppress the fertility. That is the base. That is the base. That a vaccine that is induce the adaptive immune response and make the animal temporarily infertile. That is the base for the productions of the immunocontraceptives. And where this to found such types of the antigens, it can be raised again the receptors of the hormones or antibody, where the antibody will block the actions of that hormones by occupying the receptors and blocking it interference with the actions of the hormone. Certain proteins are there also, which are playing a major role in the reproductive game, and that can also, there also the protein against that protein also the antibodies can be, the antibody response can be elicited, and that can also be used. Now, inducing the antibody protein productions against proteins or hormone. Proteins here against the proteins are Zona pellucidase protein. We are using the Zona pellucidase protein or the gonadotropin and the GNR. They are the targeted object for the productions of the immunocontraceptions. Now, the basic concept, again, I am coming back to this again, the basic concept behind an immunological approach to control fertility is similar to that of the efforts that is made to prevent the disease by vaccine. That is the same one. As we are introducing the vaccine, FMD vaccine is injected, having the antigens, low antigen of the FMDs, and they will produce the antibodies against the antibody, then will conserve will be helpful for the prevention of the disease. Like this also, similar to effect, that is here also the contraceptive vaccine stimulate the animals to produce the antibodies to key proteins that are involved in reproduction. Here there are certain proteins are there. That proteins are used for stimulations of the antibodies and controlling the reproduction. And when this antibody produce or reach a certain level, the animal become infertile. These animals become the infertile. The standard vaccines used for the prevention and control of the various bacterial or viral diseases are designed to stimulate the body defense system to produce the antibody to a particularly virus or bacteria, as we have discussed earlier also. And as with the conventional vaccine, CV, that is contraceptive vaccines, utilize the body's defense systems to raise an essential step in the reproduction process. Now, anti-disease vaccines are against immunologically foreign proteins. Now, in contraceptive vaccines, they are against the non-pathogenic cells or the hormones of own body. Here, the antibodies are produced against the hormones of the own body, whereas in anti-disease vaccine, the proteins are foreign. That is the difference. Why we are repeatedly telling what is the difference? So, the idea of contraceptive vaccines should become very clear in the mind of the students. Now, if we see the differences between the fundamental difference between the anti-disease vaccine and immunocontraceptive vaccine, the anti-disease vaccines are designed to provide the long-term, ideally lifelong protections against life-threatening or debilitating diseases. In case of the immunocontraceptives, they are designed to provide a long-term but not permanent protections against unplanned pregnancy. If we need, again, it can be a reversible. Now, here the only method of protections against such disease. However, there are various other methods are available in case of the immunocontraceptives. Now, directed against the immunologically foreign pathogen, here the directed against the non-pathological cell or hormones, as we have discussed. Now, vaccine-induced immunity often boosted by subclinical infection or re-exposure to the pathogens. Here, this is not happening. It will not be boosted by the re-exposure to the target antigen or by pregnancy. These are the difference between the what are the anti-disease vaccine and what is the difference between immunocontraceptive vaccines. Now, for the immunocontraceptions, the possible point of interventions are at the levels of hypothalamus, that is the GnRH, and the level of pituitary, FSH and LH, at the level of gonads, progesterone, estrogen and testosterone, the gametes, ovum and sperm, and the pre-embryo structural and endocrine component. These are the different points, possible points, which could be targeted for the immunocontraceptions or for productions of the immunocontraception vaccine. Now, we know that Kaur and Prabha in 2014 have published one paper. Of course, the paper is on the medical science, but it is very much applicable to veterinary also, because the reproduction function, reproductive systems remain the same for the veterinary as well as for the animal. The three main categories that are involved in the area of reproductions are targeted for the development of immunocontraception. First is the gamete productions. Another is the gamete function, and third is the gamete outcome. These are the three categories which are targeted for the productions of the in contraceptive vaccines. Now, if we think that what is in the gamete productions, we know that hypothalamus, the master, secretes the GnRH hormones, which affects on the anterior pituitary, and this causes the release of the FSH and LH, the gonadotropins, which acts both on the testicles as well as in case of the female on the ovary. Now, suppose the GnRH is blocked here, it is blocked, then the further process will not take place. That is the concept that one should go for the productions of immunocontraceptive vaccines against the GnRH. Suppose if we miss this one, then the another one is the what is the outcome? What is the functions of the gamete? Gamete has two functions. They have to fertilize. For fertilization, the sperm should move from into the female genital system, reach to the oocyte, and oocyte should mature, should produce, they should unite, and they should fertilize and form the embryo. That is their function. Another target is sperms and oocyte. Both oocytes, spermatozoa has its own surface antigen, and oocytes had the zona pellucida, which is full of glycoproteins receptors, which are responsive, which can cause the immune response. So here the zona vaccine is developed. Suppose the fertilizations could not take place, then there is no formations of the zygote and no conception. Third one, another one is the, if at all they have mate and produce this they produce the fertilized zygote, then there is a development of the embryo. This embryo will later, the trophoblast of that embryo will later secrete the certain hormones. This is only in case of the human beings, not presently not in the veterinary. But in human beings, the SCG, the human chorionic gonadotropin, is secreted as early as about 6 or 7 days of the post-ovulations, and that can be targeted. This SCG is produced from the trophoblast. If this can be blocked, there will be no further productions of the offspring. The offspring production will be interrupted. So these are the target for the immunocontraceptions vaccines. Now, if we see about the gamete productions, in gamete productions, an immune response induces antibody that binds GnRH is a promising target. We have already discussed that it is the route from there the GNR is secreted, affect the pituitary glands, and then the FSH and LH, and then these further events of the reproduction will take place. So they are all have the interest to produce the antibody for the GnRH. Now, again, one thing is GnRH is found in both male and female. So if you are successful to produce these antibodies against GnRH, will be useful for both these sex, male and female, and effectively suppress will result in suppressions of the downstream hormone, what we have discussed, that LH, FSH, estrada. When LH and FSH will not be there, there is no progression for estrogen and production also. They will suppress, and they will suppress the reproductions in both male and female. Therefore, vaccine targeting GnRH were developed primarily as immunocontraceptive vaccines. Now, vaccine against GnRH have been reported to be successful to suppress the reproduction in dogs. These vaccines were actually developed in case of the human beings. They have actually tested these GnRH vaccines, anti-GnRH contraceptive vaccine. They are using for the treatment of the prostate cancers. And while using with the prostate cancer, they found that the animal become impotent and infertile. So they thought that it could also be used as a immunocontracectives. Now, what is this? Here is the again a booster dose vaccination is required at intervals to maintain the high enough anti-GnRH and antibody titer and to suppress the fertility. That is possible because boostering is always required. Boostering was also required in our rabies vaccination, also in FMD vaccination also. So like that also here also the booster dose is required. Now, presently, there are many vaccines available as a GnRH vaccines already available for veterinary use with a limited, some limitations are there. Vextrate and Improvac are the two. There are many others we will see as we go along. The research is still, however, we can say that it is not final. Research is still under the development to obtain the potentially improved vaccines. Now, how this vaccine will act? This GnRH is secreted from hypothalamus. This is the GnRH are secreted from hypothalamus, and all animal if already immunized with the GnRH immunization, then this antibody will attach with the GnRH and will form the antibody antigen complex. This antigen antibody complex will prevent the further actions of GnRH on LH and they will on the pituitary and will not secrete the LH and FSH, and hence nothing will happen. There will be no productions of eggs, or there will be no productions of testosterone or the spermatogenesis in case of the female. This is how this GnRH vaccine will act. Now, one American company has produced the Gonacon. Gonacon is a vaccine containing the GnRH with the mycobacterium adjuvant vaccine is developed by the American company. And they have developed a GnRH vaccine specifically for dogs. And name as a canine gonadotropin releasing factors immunotherapeutics. However, a lot of debates are there whether it's successfully used in these dogs or not. People differ in their opinions, but they have produced it. Later on, the Gonacon-based vaccination, those some workers have proved that it provides the single vaccination will provide the immunocontraception up to 1 to 6 hours. So not hours, years. For 1 to 6 years, it will provide the contraceptions, and it will prevent the ovulation and spermatogenesis in male, in female and male. The Gonacon is now, but as we have discussed, opinion differ about that. However, in case of this wild animal, the wild tailed deer, horses and feral donkeys, this has been approved in USA for the use in these animals, and they say that it is effectively controlled the populations of these animals. And it also induced the infertility. They also said that it also the infertility in wild boar, cats, dog, horse, bisons, and ground squirrels. These are all the reports from all these workers from 2006 to 2030. That this is effective, Gonacon is effective. In dog, however, some abscess and drainage at the site of injection was developed. That is because of the adjuvant, and very common with the vaccine. When they are combined with the adjuvant, they are responsible for formations of the abscess, or sometimes they also form the granuloma, the sterile swelling, with soft swelling, sterile soft swelling. They are also produced, but they many a times they are auto dissolved, and the formulations of the single shot injectable immunocontraceptive GnRH vaccine has been registered in USA for the use in, already we have discussed it, used in white-tailed deer and feral horses and burros. The treated female and male can remain infertile for several years, 1 to 6 years following the vaccinations. And it has been tested in many mammalian species and shown to be a safe and effective single-dose GnRH immunocontraceptive vaccine. Why to say safe and effective, sir? Because when the GnRH was used in the human populations, on the human volunteers, what happens? These human volunteers, the testosterone level goes very low. They become impotent. There was loss of hairs, and hence they have thought over that what to do to prevent all this type of the hyperimmunology reactions or hyperimmune response. So they have again thought it that they made this carrier. They have used the carrier. Yeah. Hello. They made the carrier. They applied the carrier of the tetanus toxoid or this another toxoid like diphtheroid toxoid or mycobacterium, like that. They have used it as a toxo, the carrier, and then they go for the adjuvant with this quill A or the aluminum hydroxide like this, and then they prepared the vaccine with a controlled release for a longer period that had augmented the indigenous response, and then finally they come in conclusion that this can also be used as a vaccine. Another vaccines available are Bopriva, the Pfizer Animal Health in Australia, which include the antibodies, which induce the antibodies against GnRH. Active immunization, it decreases the testosterone in the blood level. Then it also decreases the testosterone development, physical activity, leaving the body weight gain, but body weight gain was not affected. And the immunization of female dairy cattle with Bopriva, it showed the decrease in progesterone level without affecting the estrogen level, suppression of stress, and impaired the folliculogenesis. These are all the findings with the Bopriva. Another one is the Improvec. A GnRH vaccines, Improvec, CSL Animal Health, is commercially available for use in Australia for mares only. It is available for the use in the mares only, Improvec. Now, ReproBlock is another one GnRH vaccine made by Amplicon Vaccines USA. It's actually recombinant O-albumin GnRH fusion protein vaccine and used in the developed for the use in cattle. Although there is limited data available, no much data is available on this one, and multiple injection of ReproBlock in Asian elephant lead to the suppressions of ovarian steroidogenesis for a year and reduction in uterine size and vascularity. These are all this is the findings by the Gupta and Minhans in the year 2007 only. Now, apart from this is not vaccine. GnRH agonists are not the vaccine, but they act like this. GnRH agonists are they are not vaccine, but they act like they are used for suppression of the GnRH activity. These compounds will bind to the GnRH receptors on the gonadotroph cells in the anterior pituitary. Initially, what will they cause? They will initially cause the flare-up actions. There will be high release of the LH and FSH, which will result in the increasing testosterone levels in the males, or also in the females. Female will show the stress. That initially this will happen, but after about 14 days or 15 days of the continuous treatment, the GnRH receptors are down-regulated, and they are resulting in lack of release of LH and FSH from the pituitary, which then reduce the testosterone and the levels in male and inhibit the stress activity in female. This is not the vaccine, sir, but it is a GnRH agonist. It is also used for the contraception in animals. GnRH agonist availables are the deslorelin or the suprelorin, Virbec. That can suppress the reproduction in male and dog for at least a year. Then azaglai nefarelin, gonazon, that Intervet International has shown the decreasing the concentration of testosterone for at least 6 months. Leprolites, these are the all different GnRH agonists. They can be used for the suppressions of the sexual activities in animals. Now, another target organ is the follicular stimulating hormone, FSH. That FSH play an essential role. We know that it affects in the initiation and maintenance of the spermatogenesis in male animal. That is directly under control of the FSH. It can be an attractive contraceptive candidate. And immunization of male donkey, bonnet donkey, with ovine FSH that resulted in testicular dysfunction, oligospermia, and subsequent infertility. However, no much data are available for the vaccines on the FSH. I could not find at least. And due to the certain limitations, FSH does not gain a popularity as a immunocontraceptive vaccine, is an introduction to produce the immunocontraceptive vaccines. Now, another was again another protein that is secreted from anterior pituitary only, that is LH and its receptors. That immune response raised against the receptors of LH hormone, that antibodies could block the actions of that hormone, occupy the receptors and blocking it in interaction with the hormone. The Saxena and his co-worker in the year 2002 have conducted an experiment that in adult female immunized with 0.5 milligram bovine luteinizing hormone, that for intramuscular boosted dose, they use 1.1 milligram. And finally, the circulating LHR antibodies in serum for 3 weeks, they observed that female dog vaccinated against bovine LH receptor had estrus suppression for more than 11 months and decreased the progesterone level that lasted from approximately 6 months to 1.5 years. That is with the LH and receptor. The LH antigen, again, a purified bovine LH receptor protein was used as a vaccine antigen in dogs, and immune response anti-receptor antibodies were elicited, causing a reduction in infertility. Now, immunizations with LH of adult female sheep prohibited the pregnancy during 2 breeding seasons. The mode of action, they have assumed they have what they say, that the prevention of ovulation by inhibiting the pre-ovulatory LH surge. Now, the LH has the potential applications as a contraceptive agent, but it is not widely accepted since it potentially affects the sex steroid. That is what they say. Now, another aspect is the gamete function. Now, we know that the gamete has the 2 functions only. Male has to produce the spermatozoa. It has to move into the genital tract, should reach to the mature ova and fertilize and produce the zygote. That is the functions of the gamete. Now, this approach target the zona antigens of the eggs and surface antigen of the spermatozoa. Both are available. From female side, zona are available, and from male side, the surface antigens of the spermatozoa are available. We know that the zona pellucida is composed of, it's a extracellular matrix of the ovum, and having a glycoproteins as a receptors, that these can be used as an antigen or for the immunocontraceptive, and that will interfere with the normal productions of the eggs in female. While sperm-based vaccine, it will be used in female reproduction tract to block the fertilization by interfering with the sperm movement or its functions like attachment or anything. Now, some cell surface antigens are unique. They are tissue specific, immunogenic, and accessible to antibodies. These are all the required. These are all the basic required for the proteins to be good for productions of the, unique for the productions of a vaccine. It should be a tissue specific, should go and attach to where it is targeted. It should initiate the immunogenic response, sufficient immunogenic response should be initiated, and it should be accessible to antibodies. When it is produced, it should be able to reach to the antibodies for its actions. Now, zona pellucida antigen is used in animal control, and sperm antigen are naturally occurring antibodies lead to the fertility. We are, yesterday only, we have seen that the sperm antibodies, sir, Madan sir has already talked that these autosperm antibodies are generated, resulting in the immunoinfertilities. Now, if we talk about Zona pellucida, the glycoproteins that is surrounding the mammalian oocyte, that is reacting at a receptor. And the binding of the spermatozoa to the oocyte due to the presence of specific glycoprotein receptor for spermatozoa on its surface is prevented. Now, immunization against ZP, against the Zona pellucida, will result in generation of antibodies against themselves, which bind to Zona pellucida. Thus, when a sperm approach ovum, the binding is inhibited because the Zona is already engaged by the antibodies. This is for the quick understanding of the student. See, sir, these are the Zona pellucidas, and these are the receptor sites. Now, these receptor site already preoccupied by these antibodies. Now, if the sperm comes, where it will attach, it will not be able to attach, and hence this there will be no fertilizations, and the further process is prevented. Similarly, here we have also seen that the pre-binding of the spermatozoa. If there is no there is no antibodies, the receptor is free, and the sperm will attach. If there is these receptor are already occupied by these antibodies, the sperm could not join. This is a simple explanation how the Zona pellucida vaccine will act. Now, Zona pellucida based vaccine inhibit the egg. What we have seen now in dogs, they have shown the promising results. Now, ZP-based vaccine have been used to inhibit the reproduction in rodent, ungulates, carnivores, elephants, and marsupials. Immunocontraceptions using the ZP3 has been successful in several species to date, including as now. Why ZP3? Earlier, the immunocontraceptions was prepared by injecting this Zona pellucida proteins into the rabbit, and this rabbit produced the antibodies. It has produced the antibodies. But what happens again? The rabbit remain unprotected. It was not able to produce even after the mating with a fertile male. It remained completely infertile. All these primordial follicles were disturbed when this was injected into that one. All primordial follicles were disturbed. Later on, it was known that it has become because of the atrophy of the ovary. Ovary get atrophied, and then again a study was conducted that Zona has 3 to 4 glycoprotein P, ZP1, ZP2, ZP3, and ZP4. Out of these, all proteins have the capacity to induce the indigenicity. But they have identified that the ZP3 is the only one which do not disturb the primordium follicles, but only this will prevent the attachment of the spermatozoa. And then later on, the ZP3 was isolated, and further these productions of the vaccine with the ZP3 with the recommended procedure, they have developed ZP3 diphtheroid toxoid vaccine that failed to conceive, suggesting that the ZP3 can be a potential candidate for the development of the contraceptive vaccine for the controlling the dog population. Because our contraceptive vaccine, one very condition is that it should be reversible. Wherever we think that the action should be reversible, or we wanted that particularly for this period, the animal should become infertile, that is our condition. Now, if it become permanent sterile is not our object with the immunocontraception. Now, single injections of the ZP vaccine, that is PayVac, immunovaccine technology, induce infertility in white-tailed deer and horses for up to 4 years. That is again a porcine Zona pellucida vaccine, Zona state H, for wild horses is developed. This has gained a wide popularity, that porcine Zona pellucida vaccine. They have got because this porcine Zona pellucida is not a species specific, and it's a tissue specific. But this can initiate this immunogenic response in many of the animals. So the porcine Zona pellucida vaccine got a good popularity. Now, with this, they have produced the images on this one that they have fluorescently tagged the control versus anti-Zona pellucida antibodies. And when they go for this image, see, we can see that here the image is fluorescence image is this one. This is all because of the attachment of the antibodies. This is the all attachment because due to the attachment of the antibodies. Whereas here, no such types of the fluorescence is seen. That is how this vaccine potency is checked, or vaccine efficiency they have checked and seen that they are effective. Now, another potent object for this gamete function is the sperm antigen. We know that the sperms are the having a lot of antigens, potential antigen it is having a, and it is a promising object that for the productions of the immunocontraceptive vaccine. It has both auto and iso antigen, and that's why it's result in generation of anti-sperm antibody leading to infertility. And this is the more common problem with human anti-sperm antibodies, because it is having the auto and iso antigen. And that's why a lot of problems leading to infertility for the anti-sperm antibodies are found. In case of this human beings, when the idiopathic infertility is seen, they usually think for this one, anti-sperm antibodies. And they test the patient for that thing. In our earlier study, it was in 1932 when a fertile woman was injected with their husband's semen, and the woman developed anti-sperm antibodies, which resulted in block of conception for up to 1 year. Now, fertilizing capacity of spermatozoa is depend upon the varieties of the function. There are many biological properties. See, from its motility, it's to reach to that one, its ability to capacitate, that it should to go for the acrosomal reaction, it should penetrate the ZP, and now finally they had to fusion with the eggs. All these activities are controlled by a certain type of the genes, which what we call as a proteins. And any of these genes can be targeted. We can target the motility, we can target the ability to capacitation, undergoing the acrosomal reaction, penetrating the ZP, or any proteins can be targeted. Any of this antigen involved in above said phenomena could result in the suitable candidates. Now, anyhow, this has not become much successful, because the sperm has a lot of antigen on this one, and it is some problems are there. Various approaches like genomics, proteomics, and vaccinology is used to isolate the each antigens, and then finally to prepare this antigen. The sperm antigen itself is a foreign to immune system of both male and female. It is foreign for the for the one who produce it, or will also produce where he had to function, where he had to work. It is foreign for both of them, and that's why they affect both fertilization and fertility. Sperm specific proteins, sperm specific, a lot of numbers of antigens are developed or identified. That lactate dehydrogenase and the acrosin, they are the two only what I can say, but there are numbers of the proteins they are identified. But yet today they have not satisfactory result in control of the, today even sperm antigen immunization had not satisfactory resulted in a satisfactory control of fertility. Now, gamete outcome, we have already discussed that the sperm has to go, and it has to ovum has to come, both has to meet and produce the embryo. And this embryo, when developed further, they will produce the trophoblast. That trophoblast will secrete the SCG, human chorionic gonadotropins, and this SCG will act on corpus luteum for stimulating the progesterone productions, and hence the pregnancy will be maintained. This is a fundamental phenomena of the human pregnancy. Now, generation of antibodies against SCG can provide an immunocontraceptive agent which will target the establishment of fertilized egg. This will not be this, they will prevent the fertilization of establishment of these fertilized eggs. This is only in case of the human beings. In veterinary, so there are many proteins, they are secreted about 16 days, that is pregnancy associated proteins are there, but still no, I could not go through any references where such work could be, I could find out where they have tried to produce vaccines again using such types of the protein. So this aspect, gamete outcome, is the only related to the human beings where they are going to produce the SCG vaccine. Now, SCG vaccine in National Institute of Immunology in Delhi, they have prepared the vaccine with this phase, and it is in a phase 1 trial completed. Phase 2, they have completed the trial, and it is under the phase 3 clinical trial is pending for the long-term clinical safety analysis. Anti-SCG was the first and only one control vaccine to go through phase 2nd efficacy trial successfully. The use of vaccine in sexually active women prevented them from becoming the pregnant. But up to second stage, third stage is yet to come. The result of the third stage is yet to come. Now, another concept or another aspect for the passive immunization. These are all what we have discussed, the active immunizations or the adaptive immunization. Passive immunizations, where the ready-made antibodies are used. Now, take for example, nowadays, if you talk about the COVID, the government or the organization, different organizations appeal to the people, those who have suffered and recovered from the COVID, they are requested to donate their plasma, because their plasma is containing a ready-made antibody against the COVID virus, and they are requested, they are appealed that to come and donate their plasma for the benefit of the patient, for the benefit of the sick patient who are seriously ill. And many schemes are also there to come, and if you donate this type of the facility in your municipality area, they will provide, or they will such type some recognition they will give. Such types of the schemes are there for the passive immunization. But limitations of the passive immunizations is it is temporary, it does not long last, and that's why it has no much role in veterinary. Passive immunization for contraception, I am talking about passive immunization for contraception. Immunocontraception has no much role in veterinary because they remain for a temporary, for a certain period only. However, there are polyclonal antibodies or monoclonal antibodies are there. One of them, they are using the monoclonal antibodies because of this feasibility that it avoids the cross reaction with somatic cell. It has a lesser chance of allergic reaction, and in protection of for 1 to several days depending on their half-life. But very few antigens have been explored to date via passive immunization approach. Sir, novel approach for the contraception, I would like to tell few words, sir. If the time permit, or otherwise we should novel approach, that is the development of recombinant virus that express antigen and toxic conjugates, and that destroy the gonadotrophic cell. They will destroy the gonadotrophic cell. Though no brega basuri. Attenuated recombinant herpes virus expressing fertility antigen to induce the fertility in dogs and cats. Phase GNR construct for immunocontraceptions in dogs. Novel toxin conjugated for sterilizations via gonadotropin ablations, bacterial ghost, and the virus-like partitions. Now, gene silencing or the gene therapy, inserting a new gene causing the overexpressions of gonadotropin inhibiting hormone or the mullerian inhibiting substance. These are the novel approaches. The small interfering RNA or the microRNA adeno-associated virus, they are used to silence the genes involved in the central control of the reproduction, such as TIS1 and TEC2 in cats. Now, future research deals and the issues to be addressed are, we are yet in need to the developing of a final product, which is available as a therapeutics to everyone. Then safety assessment on long-term use, accessibility of the approach, defining the mechanism of action, reversal of contraception on demand, and clarification and debate of socio-political issues. These are all the future research need and issues that is to be addressed. So, in conclusion, I would like to say, sir, that the contraceptive vaccines are effective, they are long-lasting, safe, and cost-effective. However, the efforts to develop such vaccines are ongoing. The development of a single-dose contraceptive vaccine is a long-term goal. An effective solution has yet not been found. Now, a further better understanding of the mechanisms of the immunocontraceptions will lead to large-scale applications of these methods in future. Thank you. Thank you, sir. This is what I wanted to say about the contraceptions.
Thank you, Suthar sir, for your very good informative lecture, and I am sure it will be useful to our UG and PG students. So I have two questions received from our students, and
Sure.
they have one request, sir. If you can kindly share your presentation to organizer, they will share it among the students if possible.
Very easy, sir. Very easy. I will share it.
Yeah, thank you very much, sir. Sir, first question is there any side effect of immunoprofiling, immunovaccine of GnRH on overall immunity of a patient?
That is no, not over, not they are they does not interfere with other immunity. The side effects in relation to GnRH we have already discussed that when it was earlier when given the GnRH vaccine in the human beings also in human it was tested and there it resulted into a permanent impotency, not total impotency, low level for total decrease of this testosterone level, loss of hairs and everything. Then that happens. Then they thought over that why this has happened. Then they modified the productions of the vaccines. They used some carriers like tetanus toxoid, diphtheroid toxoid, or mycobacterial, and then they go for adjuvant applications of adjuvant like calamic hydroxide or something like that, and then finally the vaccine produced was having not such types of the side effects. Side effects in terms of vaccine is another vaccine like production of antigenicity for the other, because they are very specific, proteins are specific. So they will produce the antigens against this one, against the GnRH only. So in my view, there is no possibility of any such side effects as what is asked.
Sir, another question is there any oral chemical agent available which can cause permanent contraception in male dog?
In male dogs, I have not gone through yet anything. It has not come in my knowledge while searching the literatures, because see, this all is based on literature. Okay, so I have not come across any such vaccines where this oral contraceptive, but the trials maybe they may be practicing somewhere where particularly in wild animals we cannot go there, and if this is possible, it will be a really good for these wildlife contraceptions. Of course, injectable contraceptions in wild animal, they are injecting via the dart gun from a distance only. That is possible, but the oral contraceptive vaccines availability will really very much useful for the wild animals.
You want to say
May I go ahead with some points if permitted by the chair there?
please, but be short, madam, because we are running out of time. Please.
No, if you want, I will refrain asking.
Madam, please ask.
Please ask, madam, but because we are running out of time, please, madam, share your views.
First of all, thank you very much, Professor Sridhar. I enjoyed the lecture. Sir, I would have 3 points to discuss. Number one, about the ZP antibodies, as you have mentioned, and then further you have highlighted it was ZP3. So also you have shown the concern of affecting these antibodies to the preantral and early maturing follicles. So the point of concern here would be how exactly in the in vivo system this would work, the approach is my first point of concern, sir. And second is, as you were talking about the GnRH, thank you very much for that. But of late, we have understood that it's a kinase pathway which works through, and all the estrogen receptors are only present at the periventricular or the arcuate nucleus. So eventually, the steroid has to go to the higher centers to work, and then GnRH. Under that situation, what will be your take at it? Because should we still restrict to the GnRH? And why I'm asking this, because in the last third slide, last but third or fourth you've shown that through gene silencing, you would like to address the Kiss15. Sir, I would like to share here that Kiss15 gene knockout or knockdown, both are pretty difficult. We have worked, we have used siRNA technology, and in vitro in the cell lines, we have shut all the three, Kiss15, neurokinin B, and the dynorphin, also the leptin receptors. However, in the large animal, it was very difficult. So we have gone through the mouse model, because you have to use a stereotactic apparatus and go through the skull to first locate the arcuate and periventricular nucleus, and you have to inject whatever shRNA is there. You have to put it there. And we have taken more than 6 months to learn it, to put it over there and then to silence it. Then pups were not born. So these are 3 points. What is your take at that? Thank you so much.
No, madam, thank you very much. You have a very good question. These questions are really need a answer from a very expert one. The experts who is doing, who is concerned with everything, this one. But what I want to say that these are all the limitations. These are all we have to we have to come across, and we have to solve these all limitations. See, for siRNA, they are not injecting into the skull. They are not. They are using.
No, sir. They are not a skull. We are not supposed to inject in the skull. We have to open the skull, and then we have to go to the nuclei. If we have, it has to go to the because you
yes,
cannot inject it intramuscular, or it has to go on site, so that those genes are shut. Those genes are shut, and then they do not downregulate. They do not come down to the pituitary, hypothalamus, and pituitary, and then the steroid blockage. This is the pathway, and I think there are enough papers. So we worked for 5 years, and it's a limitation which is coming in the rat itself.
It's a limitations, and yet need this some types of the research, high research, and that is why one should go for through and through. That the last 20-30 years they are working, yet not come to a satisfactory result. They have to still work for further for few days, few years more. That something will come
sir,
out.
I think for Kindi's last 7.5 years, people are working. Anyway, thank you so much.
Thank you very much, sir. Now, sir, please 1 minute, sir. Sir, I pray Madan sir to please, sir, comment or otherwise give your critics or anything. I am waiting. Please donate with me that, sir. Sir, I am unable to listen you, sir. I can't listen you, sir. Madan sir is not.
Madan sir, hello.
Hello,
please,
you are.
Please unmute your audio. Yes, sir.
I hope now I'm audible.
Yes, sir. Please.
Yeah, I have not much to contribute in terms of Dr. Sudhar's presentation, which was really very explanatory and got into the intricate aspects of reproductive control. But I have an issue which is much more important to us with respect to the reproductive control in canines. Now, whenever we are trying to say today, when we are trying to bring about technologies, when we are trying to think of reproductive control, of whom are we talking of these as canines in this country? About 20 million of them are around. And when we are talking of we have to do any interventions, we should have somebody to stand by the side of this animal. What has been being done is that you go on the roadside and get hold of the canines and then say that we have to do a control on them. And we know what has happened to that. I think that Madam Sarita will be able to support me in saying that I remember in 2008 that there were about 36,000 sterilizations which were done in municipal area in Bombay. And in 2018, that it has come down to only a few thousand. Now, the menace is there. I'm saying this menace because as a veterinarian, I'm concerned about this tremendous amount of loss which we have in human, about 30,000 to about 30,000 people dying every year. About, I would say that about 36% of the loss due to rabies is only confined to India, of the total world losses, because it is very endemic. And this is because of these stray dogs, uncared for dogs. If we talk in terms of the control then, as of today, that control which is such is concerned, immunological control and clinical for fertility, we have got what we call as commercially available in United States preparations. I am sure that Dr. Suthar will be aware of gonazon, Nutrosol, Estetriol, Infertile. These are all products which are available commercially for fertility control. And these products are not something out of the blue. They are born out of which has been done very extensively in the laboratory and proved their worth and are in practice and in use in this case for fertility control. And when we go over into the immunological aspects of fertility control, that as he said it, that we have little milestones yet to cross before we can go into it. Thank you. That's what I wanted to add as a supplementation to what a good presentation we had from Professor Sudhir.
Thank you, sir. Thank you very much. And lastly, I thank the authorities of the Junagadh Agriculture University, particularly the Dean and Principal, Dr. Tang sir, Dr. Wala, and all Dr. Arun and all associated. Thank you very much to give me a chance to speak with you and to address these our students. Thank you. Thank you very much.
Thank you, sir. On behalf of
I just wanted to ask Sarita for this for a minute. That is it that why is it that the thing has lost? Because there is no support, financial support, there is no public support, and still we are talking of this cruelty to animals, and it's become so awful to talk about cruelty to animals in India when we know that there is a cruelty to human beings. In UK, that as an example, that they euthanize about thousands of million, I would say, of animals are euthanized. Dogs for that matter. But to touch a dog in India means that you have gotten a stick on your head. So I think that there is a concentrated effort to be made in that direction. Could she comment? Could you comment, Sarita, that why is it that it has now fallen and rabies is increasing and we are not bothered about it?
The Animal Welfare Board of India, the euthanasia of only is who are incurable. That's all. I mean, you can't euthanize the animal.
I'm saying that why is that sterilizations, which was about that you used to spend quite an amount of money, but now it has come down completely.
No, sir. Mumbai, it is. The centers are still doing. Maybe the number is variation is there, but the sterilizations are still continuing in Mumbai. It hasn't stopped at all.
The figures available with me say that 2008 it were 36,000, and in 2018 it is left to about 6,000.
Sir, I will have to check that figure, but as far as my knowledge goes, the sterilization centers are still working fully. Maybe this Corona period they were not working.
You are aware that there are about 12 NGOs which were also
yes.
And now everything has dried up out of it. About 156,000, 1,56,000 rupees were supposed to be supporting that program. But now that support. But we are saying that we are talking of animal welfare, but we are not talking about support into these things. That where we should have our disease load coming from these animals, and that's what Professor Sudhir said, that the control becomes very, very important in these animals. But there is no support coming for that.
Yeah, but there are many organizations, maybe they are not reporting, but private organizations are also, what figure you might have is from BMC, but there are so many private organization, individuals rather, they are working towards neutering of dogs and cats as well. Many of them are working on their own. Maybe those figures are not reflecting there. I will also go through the figures. I don't have latest figures, but I can share them later. But many people are doing. For example, we concentrate in a small area and are doing it. Comparatively, the dog bite incidences in Mumbai, the rabies incidence in Mumbai at least has come down. I may not have exact figures, but definitely it is lesser.
Okay, thank you, Madam and Madam Sir, for a good discussion on the topic. Thank you very much. I would like to thank Speaker Dr. B.N. Sudhir on behalf of Dr. P.N. Tak, Principal and Dean, Veterinary College, JU Junagadh, and all organizers, Dr. Wada, Dr. Sharma, and his team, and IDP Nahab for arranging such a wonderful lecture. So thank you very much, sir. We,
Greetings to you all. Bye.
we are waiting next speaker to join. Please bear with us. He will be joining too soon to this lecture. Please wait for some time. And students, I am delighted to introduce our next speaker, Dr. Dilip Kumar Swain. Currently is working as assistant professor at the Duasu Mathura. He completed his BVSc in the year 2004 from OUIT Bhubaneswar, and subsequently he did his MPSc in the 2007. He completed his PhD from NDRI Karnal in the year 2014, and his area of specialization is reproductive physiology and physiology. Currently, he is working on signal transduction mechanisms in spermatozoa regulating fertilizing competence in specific reference to ion channels and non-genomic membrane receptor signaling. He has a research project and he has developed technical skill on advanced proteomic and genomic tools, fluorescent microscopy, scanning electron microscopy, confocal microscopy, and 3D imaging of cell. He is also having a skill on flow cytometry in evaluating cellular parameters. He has published about 60 research papers, including 25 in international journals, and he is working on currently on 4 projects. Among that, one is externally funded project. He has to his credit best poster award 3 times and best paper award 2 times he has received, and his university gold recipient of university gold medal during his MPSc and best young teacher awards, and he is also qualified for ICR SRF for PhD. With this short introduction, I invite and request Dr. Dilip Swain on behalf of College of Veterinary Science, JU Junagadh and NAHEP IDP to deliver his lecture. Thank you, Dr. Dilip, please. We are connecting to the speaker. Please wait for a few minutes. Dr. Dilip. Dr. Dilip, please unmute yourself.
Yes, sir.
Yeah, you are audible. Please, you can continue. Floor is yours.
So should I start, sir?
Yes, please.
My screen is visible.
Yes.
You can share your PowerPoint. Yes, now it is visible.
Is it fine?
Yes, please go ahead.
Okay. So good afternoon to all of you. It's really a pleasure moment for me to present a practical demonstration on CASA. How this CASA can be used for assessment of the sperm motility and motion parameters in the evaluation of male fertility. So before presentation of this topic, let me tell you a few things that what actually we have planned, because this is an online platform and here I cannot demonstrate the instrument directly. So what we have preferred, now we have made certain videos, the real-time videos in which we are demonstrating, means I am interested to demonstrate that how semen samples are being processed before analyzing through a CASA. So before going to that, let me introduce few terminologies and then we'll start sharing with these videos. So this is my tagline: together we learn, together we grow, together we fly, together we dream, and together we win. It is a team which wins, not the individual. So this is the startup. CASA basically is nothing but computer assisted semen analyzer. This is a proven process that a computer is integrated with a microscope. The microscope is integrated with a high-end camera. This camera is having a large frame per second, around 100 or 200 frames per second. So it can capture images. Then the microscope is equipped with almost all the types of objectives, filters, that which can capture the images of moving cells, because sperm is moving. So we always need a high resolution camera. The third one is an integrated part. That integrated part is the microscope to that of the computer with a software. This software is actually the algorithm which contains all the informations regarding the analysis of this spermatozoa. And this algorithm takes the message from the camera, integrate it, then after integration, then the interpretation part comes. After the camera part, there is another part is there which we should not forget, that is the operator or the person who is handling that instrument and is going to perform the semen analysis. For the last 8 to 10 years, we are continuously using the CASA system, but very unfortunate to say, still we are learning, because every day we are seeing that CASA needs standardization, optimization, and precision of the CASA always depends on the operator, how you are handling the sample or you are going to do the analysis. Now question arises, why we need a CASA? Is it really required? Because motility can usually be assessed under a microscope. You can simply put a drop of diluted semen, put a cover slip and see under 10x, 20x, 40x objective. You can see the sperm are moving. But I'm telling you one fact, that human eye can only see at a time 2 of the moving objects in one direction or in opposite direction. So that's why when a field contains 100 to 200 number of spermatozoa or more than that, it is impossible for the human eye to integrate on every spermatozoa. So that's why scientists have developed this instrument. This is for precision and efficacy, reproducibility of your data. What I am saying that 40% of the spermatozoa are moving, that may be correct. But I cannot say out of that 40%, how many are progressive, how many are fast, how many are slow, how many are circular, how many are local. It means what I am saying, that differentiation of population or subpopulation of the spermatozoa in a given sample of semen always depends on this parameter, that is efficacy. And that part is being done by the camera. Now question arises, what the camera do? The camera captures the head part of the spermatozoa, tail part of the spermatozoa, integrate the head with the tail, and then send the message to the Computer. Computer has a very well and very means standardized software. These softwares are usually patented and developed by the company itself. And once the software gets the message, now the duty of the software is to integrate those images, frames, tracks into percentages data. That with what we are seeing. So CASA is required for optimization or optimized analysis of motion, motion parameters. Along with this, another very important part of the CASA system is the motion velocities. Velocity means velocities and distance, means how much distance the spermatozoa is moving in an axis. Number 1 point. Number 2 point, how much of distance is traveling per second. That means velocity parameters. So all these parameters make the CASA very unique. But very honestly saying, analysis of the CASA parameters require expertise, experience, and lots of literature we have to analyze before interpreting the data. Mere seeing the motility percent never gives the idea about the semen. Just one example, a semen is having 70% motile spermatozoa. Should I say that it is a high motile semen? No, I cannot, because I have to see the subpopulations. If the subpopulations are showing fast ratio to slow is 2:1, then I can say that yes, it can be a semen which is having high fertility competence. For example, reverse means slow spermatozoa are 40% and 10% are fast, and the rest of the others are around 20%. Whether this semen is optimized for the process of fertility? No, this cannot be. So what I am interested to say, that anything which is said to be good or bad requires multiple parameters to be analyzed. The CASA works on the same principle, that it always relies on efficacy of analysis depending on how we are processing the sample. We have optimized our instrument, optimized the counting chambers. So that's why this presentation will encompass all these things, means various aspects, quality control aspects, and then interpretation part. This is the master diagram of the CASA. So this is probably my last slide before I should leave this platform and demonstrate you. This is the actual platform which shows how a CASA works. Let me explain you. Here, these points, where my cursor is moving, these are the sperm heads. I can say these are the marker points, and we can tell them as, you can use the word centroids, you can say them nucleoids, or simply you can say head. So this is that head. When the spermatozoa moves, there is a possibility that the spermatozoa may move in a straight line. So this is the straight line. The spermatozoa move in this manner, as if it is being drawn. Sometimes the spermatozoa moves as if it is there in an average path like this. So what I'm saying, now this is the most important diagram which we should understand before performing CASA. Movement of the head is never on the straight line. It is very unusual, because sperm always follows a track, and this track may be linear, maybe curvilinear, sometimes it is straight. CASA records these head positions, and these head positions are the head positions. And once it is acquiring the head position, now it is the duty of this is to integrate that head positions and calculate the distance, the various types of distance. For example, straight line path, curvilinear path, average path, means what should be from the initial point to the last point, what should be the average one. So like this, various parameters are being analyzed. One of the important parameter to study the motion is how much this head is being displacing for the main position, and that is known as amplitude of lateral head displacement. Here it says that the head is being deviating from the average path, or we can say that the head is deviating from the straight line path. Beat cross, it indicates how much time the flagella is being swinging or vibrating, or you can say it is in oscillation. And that decides whether the sperm will move in a track, a straight line path, a curve path, or between the straight line and the curve, an average path. Now, these are the various terminologies which are being associated with CASA. I will explain one by one. This slide shows a basic setup of a CASA. All CASA, whatever made in world, all CASA are having their cutoff values. They are values which classify this spermatozoa. As most of the audience are here, students, you cannot understand what are cutoff values or borderline values, or I can say these are ROC values. But please remember, all the CASA are having their cutoff values. Beyond this or below this, the spermatozoa population are classified. Whatever I have shown in this slide, this is the cutoff value of the mini tube CASA, because I am having a CASA from mini tube. These are the different parameters which are measured: total motility, progressive motility, fast, slow, local, circular. Then these are the various types of motion parameters. Why I am not taking more time here, because I will explain all this thing. And this slide I will come later on. Now I am showing you some of the things which I think by a very small video, you can understand that how to prepare actually the CASA samples for the purpose of analysis. I think this video may be clear to you. Just have a look. And if you are having any problem, then I will help you out in solving that.
Dr. Dilip.
This video will show you step-by-step procedure.
Dr. Dilip. Hello, Dr. Dilip. Dr. Dilip. Hello, Dr. Dilip.
Yes, sir.
Can you please start your video screen?
Yes, sir.
Then video will on.
Dilip sir. Dilip sir. Am I audible?
Yes, sir.
Please again go to the share the screen, and then you have to choose the video for the screen sharing again.
Yes, sir. You are on.
Please go to the share screen.
Hello.
Yes, sir.
Now is it okay?
Wait, sir. It is starting. Wait.
Only you are having VLC, I think. Is this video is visible now?
Not, sir. You have displayed the again that particular tab. Again, go to the share screen, and where the video is running, please select that particular screen.
Okay, okay.
Video is running behind that tab.
I got your point.
Okay.
Just give me 1 minute time. I'm sharing. System कोर्स काम नहीं कर रहे चलता है this one नहीं चलता Is it visible now?
No, sir.
No, no.
Not yet.
It is not working.
No, sir. It is working, but you have to select it. First, go to the share screen and then select the video.
मैंने छुपा दी, ये काम नहीं कर रहा ये वो।
अनम्यूट करो ना। दिलीप सर।
Power pack system. Now I'm coming to the second part. The second part is the power pack. If you on this, then the bright light will come here. The second one is a fluorescent attachment. This is the fluorescent setup. Because this microscope is having the fluorescent attachments to carry out different types of tests like
दिलीप सर।
microbiology, fertility, DNA fragmentation.
Yes, put in a direct video.
And the third is the power pack, which is called the cell. Here and the stage. चेक पूरा मतलब चलिए। मैं जिस चीज को डरता था ना मेरे साथ वही होता है। ये कैसा लैपटॉप है आपका? कोई सिस्टम ही काम नहीं कर रहा है इसमें, कुछ भी नहीं काम कर रहा है इसका।
दिलीप सर।
सर ये कनेक्ट ही नहीं हो पा रहा है मेरा।
आपका सब कुछ चालू है यहाँ पर।
हेलो I'm living in this lab that is from Munich, Germany. The name of the CASA is Endovision. So let me introduce the CASA system first. A CASA first starts with the word computer. So this is that setup of the computer. This is a high-end computer. The RAM of this computer minimum is 4 GB. Here we are having 8 GB. It is having a hard disk. Our minimum is 1 TB and we are having 4 TB. So that is what I am saying. This is a high-end computer because it contains all the information related to seminology. Seminal attributes, what we are going to measure, that is going to be stored in this computer. Coming to the second part, that is a microscope. This is one of the most essential parts of the CASA, which decides the quality and the concept of the CASA is relying on the integration between this microscope and this computer, along with this camera. So let me introduce this microscope. Every CASA is having their own microscope. We are having an axioscope microscope that is from JIS. This must be enabled with a negative phase contrast. This is one of the most important requirements of CASA system. Second, it must have a stage which must be heating one. And here the cable, it shows that it is a heated, it is having a heating thermostatic stage. And this cable shows that yes, it is connected to the power pack system. Now I am coming to the second part. In the second part, this is the power pack. If you on this, then the bright light will come here. The second one is a fluorescent attachment. This is the fluorescent setup because this microscope is having the fluorescent attachments to carry out different types of tests like mitochondria, ecosome, viability, DNA fragmentation. So that's why we are having a fluorescent attachment. And the third is the power pack, which is for this hot plate, which is here, and the stage. All these integrated systems are working in tandem. That means they are a single setup. Now, this microscope shows in this monitor, you can see, it shows various types of parameters which are there in this Androvision version. So when I will perform the CASA, then I will show how this software operates. Now coming to the second part. Second part is semen processing. When semen processing again depends whether you are doing in ejaculated semen, that means simply diluted, which is not frozen or processed, or second, whether it is a frozen semen, which is coming in the form of straws. Take the straws, properly thaw. Just a minute, I am showing you a very good thawing unit concept. Nowadays, this type of thawing units are coming. These thawing units, they are having thermostatic chambers along with the concept of vertical freezing. You can see this. Here you can put your straws. This is the lid over which the straws can be put. This chamber shows that it is the chamber for the water. And in this, you can deep for vertical freezing where shows uniform distribution of heat. That already I have discussed. And after thawing or after initial processing, actually sorry to interrupt. Nowadays, usually vertical thawing units are available, and vertical thawing units are very functional in the sense they allow uniform dissipation of heat. So that's why earlier horizontal thawing units were used where the thawing is not proper. And this type of commercialized thawing units, they allow dissipation of this heat from both the sides. Of the sample, the next part comes the temperature. For the maintenance of constant temperature, we do have a dry bath. This is automated, cheap enabled dry baths. They maintain the temperature, optimized temperature of 37 degrees centigrade. You can maintain 38. You can also maintain 36. It solely depends on you. We keep completely diluted, non-diluted process samples here, and this is timer based, so you can keep for hours together. Once your semen is processed, then the next theme is dilution, because this is a quality control point number one. Because many of the people, they do not know how to handle semen in vitro or in a laboratory. So it is very essential that whenever you are getting semen samples, be sure that you are not altering any of the physical properties of the sample. That means you are not providing any sort of injury. You are not doing very and very manner. Rather, it should be in a very consistent manner in which you are going to dilute properly. One thing I am showing you, some people dilute the semen and they start doing like this. So this is not allowed in semen processing. Semen processing always says that you dilute the sample and go for vorticing. And the vorticing should be uniform, 1, 2, then again 3. So this 3 times it says that uniform distribution is there, and even you are thinking that it is not even, then you do 1 or more 2 times. Always remember these are quality control points because this is going to vary the data which you are going to analyze through your CASA system. The second part of the CASA system is the chamber in which you are going to count the spermatozoa, or you are going to estimate the motility. This is one known as Mackler chamber. You can use this as it is an open system, so that's why you can use it. It is a reusable, and you can count innumerable time without altering the sperm. The second one is a commercial. This commercial slides are known as sperm counting chamber or the laser slides. But here this is being provided by the company itself, the mini tube. And I have taken only one slide. Here 4 chambers are made. These chambers are made in such a way that it can only contain 3 microliter of the sample. and the slide shows that on the back side nothing is there, no chambers are there, but on the upper side, yes, chambers are made along with a cover sleeve. It's a patented technology, always given by the company, and we have to follow the principles of the company. Now the concept is what? Now these are the loading sites where it is small letter, it is written as A, B, C, D. You have to touch. I will show you how to load the sample, because this is quality control step 2. That was number 1. This is number 2. In this step, the most important, usually macular chambers are being used when you are going to do the motility analysis. This is reusable slides. But when we are using the sperm counting chamber, they are commercial. And what I am interested to say now, this is for more precision on motility and concentration. So what actually the process is now, this macular chamber sometimes give you a data little bit lower or more, but these commercial slides, they always give an accurate estimation of the data if the handler is fine with dealing with that. It only shocks 3 microliter of the sample as it has been commercialized. So when I'm loading that, you can see that through capillary motion, it is moving. Parameter is to see whether your slide is at 37 to 38 degrees centigrade or not. You can see here the temperature we maintained in that. And this temperature, why we are keeping 1 degree, because it is outer, and we want to keep the temperature constant. So that's why these chambers are now ready, the slide is ready. Now here, whether this thermostatic plate is maintaining 37 degrees centigrade or not, you can see here the temperature is showing. So 1 degree more we are keeping, because that temperature in 38 means 1 degree is dissipated from the flat surface. So that's why we usually keep at a temperature 1 degree more as compared to the normal infusion temperatures. So this is quality control step number 2. Now coming to the most important part, where usually the experienced, not experienced person varies, because we usually use negative something figures. Always use the names of the appropriate size. Nobody cares about this, but by our experience in the last week, we have seen that empathy plays a major role in this analysis. Number 1. Number 2, empathy should be very proper. Number 3, empathy should be unique. Number 4, empathy should be done in one direction. Number 5, empathy, once it is done, it should not contain the reservation. Next, number 6 point, depending on the property, you cannot insert the same. Number 7 point, depending should be in one direction. I am showing you this is not one direction. Or I am showing you like this is one direction. Two directional like this, like this, like this. So this is wrong, because sometimes depending should be always in the single direction. You can keep an angle of 45 degree and always find depending on the bottom itself. Never from the solution like this. You are making the solution from here, then here, then taking the slide here. It is a wrong procedure. I am showing the last procedure, which is the correct procedure. I cannot come to this second sample out of the trial. They should be there. Once you mix it properly, give this viable shape of the temperature. Then keep the slide here, take the pipette, take the key, go here, even 3 micrometer, and then come and go. You cannot do it properly. Sometimes people load in a aperture second samples about this slide and they give wrong information. Now I'm coming to the 8th critical point that most of the fellows have neglected. Once you fix the picture with 3 micrometer, you prepare 3 micrometer, and you always dispense the 3 micrometer. Never dispense more cement or less cement into the chamber. This is to ensure 9 point. Never remove the slide
loading, you pull out your slide, you keep the slide here, take the semen sample, then load. As I am doing for the last 8 years, no issues. We are getting that much of experience here. Only the optimization is important, so you make wrong practices to get wrong results in the future or in the present. So these are some of the points which I want to discuss in a preliminary phase. Next, we are going to discuss about how to load the sample.
So loading of the sample in the Lija slides is very important because loading is totally based on capillary action. So it is a very strong suggestion that loading should always be done with a negative sucking pipette or vacuum pipettes, and that should be unidirectional. So in the next video, I'm showing you how this is being loaded from one side. So this second video says that how you are going to load the sample before the process of analysis. Once this video will over, then I will come to the analysis part and that I will explain. Sir, is it visible?
Coming to the second part.
Dilip sir, your video is not visible.
Okay.
Please go to share the screen and select that video.
Just a second, sir. Share the screen. I'm selecting.
Share the screen and then select that video running behind that Zoom application. Okay, now we are starting. Okay, sir. Now it is okay.
Okay, working. Voice. Voice is not coming. You are not audible, Dr. Dilip.
Am I not audible?
In video you are not audible.
The video is audible?
Video is running, sir, but we are unable to hear the voice in that video.
So what is the problem? Where the problem is?
Please resume your video, sir.
I am not getting. Once again. Is this visible?
Not, sir. Please again share your screen.
Okay.
So coming to the second part.
Is it now okay?
Not, sir. You have to share the screen and select that video running behind the tab. Please go to the share screen and then select that video which is running behind the screen. Okay, sir. Now it is visible. Please move ahead. Okay. Sir, we are unable to hear the voice of video.
The video voice is not coming.
Not, sir.
So where the problem is?
It is quite difficult to, sir, say. But if it is possible, you can explain the video simultaneously.
Yes, I can explain, but actually that will be not means exact. This will be.
Okay, let's start.
Dilip, you explain as such directly. If the voice is not there, you can explain.
Okay, is it now okay?
Okay, sir.
Sound is coming?
Yes, please explain, sir. Video is also.
Okay.
This is very common. Reports, database.
Actually, this is the system of the Endovision. We shows the screen, and this screen is having several parameters. There are higher parameters are also there for livability, ectosome, DNA. These are also the parameters nowadays coming in the CASA, besides this motility and concentration. So in this particular software, there are many multiple sites are there when we can load the sample both for bright field analysis and also for the fluorescent analysis.
Dilip sir, your voice of video is coming. Please.
Hello. Okay.
Page 448. This is that poll number. So click on this. Once I will click, directly double click, it will open and you cannot add anything. So here many buttons are coming. Number one, user profile, goals, donor ID, all these are image parameters that are not going to discuss because whenever you are going to handle the CASA, you have to learn all these things. And every CASA fundamental. Now, dilution is important factor. I'll tell you later on, but here for demonstration, I have diluted to 29. Now, this screen is blank. Here there are so many options. Let us go on coming to the most important part. So I will say it's the whole chamber and it is having a size of 3 volume of 3 micrometers. So I will take 3 micrometers sample. Then I will show you how to maintain the quality. So here I am taking the middle part of the. So this is the most important thing. You have to touch here. This is the capillary flow, and you want to force and directly go with the capillary. So you can show it. It is uniformly sprayed, and now I'm showing this is uniformly sprayed. I have touched on one side. Now I'm taking the slide. The slide is on the A side. I adjusted to this time. Then I'm focusing it. And the most important thing is focusing because I have to come to that point at which this is going to be visible. So now it is focused. Now you can see the monitor. Here the monitor is visible. The sound. You are moving. So this is the beauty of this slide. And now it is fully focused. You can see the neat and neat pattern. Then I will come and I will go for the analysis. Click on the analysis button. So now it is analyzing. And once the analysis is going on, different charts which are made by this parameter are visible. When we here is point fertility is 86%, progressive is 84%, circular is 6%, 70%, like this. The parameter. The next parameter, the third part I will tell you about the parameter. In the new field, again I am changing the field. You can see if the second field is coming either left or right or up or down. One. You can see here one which is showing a different type of motility. That I am talking about. And now I have taken 2 fields here. Sample 1, we have captured 114 per meter square. So this is the down or up field. Now you can see another field is coming. We have captured. See how beautifully it is captured. Once your field is different, the number in the option because here almost all of this particular field is 1, 2, 3, 4. So it's all that quality capturing of the image is very important.
It is always essential in a CASA system that the measurement in a macular chamber, it should be uniform. Either it should be from left to right or right to left. It should be from up to down or down to above. If it is not completely mechanized, because nowadays CASA are coming with mechanized stage, if it is not there, then always try to maintain one direction, either from left to right, right to left, or up to down or down to up. It maintains uniformity and never move the stage haphazardly. Otherwise, it will give you wrong picture of spermatozoa and the number may rise and that is known as coefficient of variation. And if CV is coming more than 20%, then your data is going to be wrongly interpreted at end. So it is a very genuine advice that always try to move the stage from one side to the other so that uniformity will be maintained.
Let's have a field, please. So this is another field we have taken. You can see here the number of spermatozoa they have moving in different types of plants. After one side capture, I go for analysis.
It is also essential after loading within 10 to 15 seconds you have to capture 5 fields. If it is a mechanized stage, automated stage, then it will capture within 8 to 10 seconds. And if one human is operating, so hardly 15 seconds is allowed because it is a tendency of the spermatozoa to move from other field to the same field. So what happens, the concentration of the spermatozoa varies from field to field. Therefore, it is always suggested that in the CASA, once the sample is loaded in the slide, immediately progress. Otherwise, what will happen? Now, it will give you wrong picture.
This is another field for the demonstration purpose. I have taken the 5 fields. Then after analysis of the 5 fields, yes, the 5 fields are over. We have captured 409 spermatozoa. We have taken 5 fields. Our sample is 1. And today's concentration, it is showing the concentration is 1361 million, 1.36 billion per ml. So these leader slides are supposed to be used when you are going to calculate the concentration along with motility. Because motility we can analyze from any slide, but for concentration and motility, any concentration, you require the slide because these are precision slides. They do have their precision in volume. So once you calculate this, now the final button is accept. Once I click the accept, now the data is captured. So I need to see what data I have collected today. Then I will go to directly I will go to the course. Then I will go to the report. Then from the report I will go for the standard report. Once you click the standard report, the report will open. You can see here there is the next September. Timing it is showing. Specific provide. I have already said this is a 448 report. Donor stock concentration is coming in the 5 days, that is 1,000. Total motility 83%. Progressive motility 2.64%. Rapid 72. Progressive circular 3.4. So these are complete data what this system has captured. Progressive circular 3.4. Local zeros, low 7%. Local. It is the more which is belonging to immortal.
So sorry to interrupt again. Here actually the issue is that these data are not being visible by your naked eye. So that's why the CASA system helps us in determining all these parameters, and that's why CASA is essential in modern day research. But what I am interested to say that these parameters will maintain uniformity only when you increase the number of spermatozoa. This is first. And second, your precision of loading and acquisition, they count. Because we have seen that if you change the medium, if you change the operator, if you change the loading volume, or if you even if change the field very regularly, then the results vary. Once this video will be over, then I will touch every parameter and I will tell you how these values are interpreted.
Now see, the real practice begins from here. A real practice. You can see that all details have been kept. You cannot change any data. Here the date of the date of September, total number of analyzed, 403, number of 5, concept average concentration after 959.56, total motility parameter, and then the parameter which is much kinetic parameters which I am discussing. I am going to discuss data which is coming here, now it is classified with chart. After this chart, you can go for the velocity. Velocity. So these curves shows how much of average mass. Exactly. Here what happens, now my child on an average, the average given there, you can see here the average is 169.89. This is per linear velocity. You can see here, this is there, 169.89. But once I come to here, it will say me what level this was spreaded and how much of population. So this is one form of analysis. I discussed vividly. Again, every CASA is having their own system of analysis and interpretation. So in this very CASA, there is a very good point is that once you calculate the total values or the average values, now the system is so integrated that is going to show you the subpopulation. So here the concept of this subpopulation arises. What it says that the semen is not a homogeneous mass of sperm cells with equal caliber or importance or kinetics. Rather, all these spermatozoa is having their own characteristics, and in a sample they vary. So what is the point here? Now here this classification justifies that who is having how much of curvilinearity, how much of straight linearity, what percentage of spermatozoa is showing curvilinear velocity or straight line velocity, what is the average path distance of which population, which is the maximum population, which is the minimum population. So what I'm interested to say, now in research, yes, these values are countable, but once we are doing the routine analysis of the spermatozoa for the student activities, usually these parameters are not required. Rather, the average value counts. What is how these parameters can be interpreted? Why we are spending so much of money? If we can see by our naked eye, why we are spending? So that we will discuss. Now coming to another important point, if you want to see whether your CASA reports are accurate or not, you can go for a details. Here there is an option for create details. Once you click it, it will take time, but it will highlight almost all these spermatozoa. They are sperm attributes. You can see here all the. This is one of the unique features that in a spermatozoa sample, suppose we have analyzed 400 spermatozoa. Try to focus on this point, because once it is 400 spermatozoa, so I do not know what is the average value. The average value is coming on the screen. But now question arises, which kind of spermatozoa I am having that semen population. So what to do that? Now for that, we are always interested to see the detailed report. Detailed report means sometimes we will see how much of fast motile spermatozoa there, immotile spermatozoa is there, and that's why what I am saying now, this report you have to see. In this report, a 10 to 20 pages report will come, and in that report every spermatozoa of every field they are classified. If you can see see this video, there is a classification on all sides. After this video, I will stop the video and I will tell in my presentation actually what we are going to learn from this. Just 1 or 2 minutes more. Motility, average, all then number of days, 1, 2, 3, 4, 5. What is the data to be? So if you don't like it, delete. And after that, you can see now this is the basic almost practical every spermatozoa. All the data being classified and they have been incorporated in the report. This is once this detailed report is there, you can cross-check every spermatozoa. Because people usually put the question
that whether you are saying the correct percentage of spermatozoa with correct kinematics. So nowadays, whatever the CASA are coming, particularly this mini tube CASA, I'm telling because I'm using this. It focuses every spermatozoa. If somebody will ask me what is the character of 115th spermatozoa, I can also say I just open that, I will go to that site where it is written as 115, then I can pull out the track values and I can explain that what is the actual character of this spermatozoa. And here CASA pays, means the money is here worth.
So once these data are available, now it is the duty of the researcher to handle the data, analyze the data, and to carry out the further studies. So this is for the part 2. Before concluding the part 2, very important. Number 1, I said that the samples should not be moved from the driver. This is number 1. Number 2, when you are doing time by experience.
So from here I'm skipping and now I'm coming to my presentation. So in the presentation part, I will include everything what I have shown in this video till now. Now I'm directly coming to the presentation. Basically, the CASA system captures all the values. Now the values are with you. So how to say that what are these values indicate? How to present whether it is a good quality semen, bad quality semen, or the characters are being changed. How to demonstrate to the people. So now yes, sir.
Please share your screen. We are not able to see that.
Yes, sir. I'm sharing just. Just a second, sir.
Okay, please.
Is it visible now, sir?
Now.
Is it visible?
Not yet.
Yes.
Yes. Now it is visible. Please.
I'm Excuse me, I'm audible?
Yes, please continue.
So up to this part I have explained. Now the last part of my presentation is just to say how to interpret. Because already I have said this part is most important, and for this we are paying the money to the CASA softwares. So this is that track which we are going to see, which usually a CASA never shows us. This is that technology which they just keep hide. So now coming to the real picture, if you can say here, the round structures, they are nothing but the sperm heads which are classified as centroids. When the spermatozoa is said to be progressive, you can see the centroids are almost maintaining equal distance and they are at equal distance from each other. So this is the characteristics of progressive spermatozoa. Now coming to the first portion, that is intermediate, this is a first population. Here you can see the centroids are having little bit more distance, less distance, but gradually the distance increases and sometimes the centroids are crossing each other. And coming to the third part over which many people are working, and this is one of the fundamental aspects of study of semen, that is hyperactivation. What we say it as capacitation. And hyperactivation is the mechanical form. Here what happens, these centroids, they move cross each other at a particular angle, and now you can see the centroids are showing distance among themselves. So this picture shows that the centroids are way apart. They are deviating from the normal path, and once they are deviating from the normal path, they will decrease the straightness, they will decrease the linearity, and it is an indication that the spermatozoa is moving in a hyperactive manner. That means in a letter 8 shaped manner. and this is the terminal part where the sperm is activated. So without a CASA, it is very difficult to say whether the spermatozoa is hyperactivated or not. This is the diagram which we have collected from our system itself. What we are going to show in a real-time basis means how this spermatozoa is being classified. If you can see the first one where it is written as cluster 2, you can see here in the cluster 2, the tracks are being made very small tracks. In cluster 3, track is very lengthier. In the cluster 4, you can see still lengthier, but in cluster 1, this is just so longer, but it is almost straight. And once it is almost straight, then the average path velocity increases, the linearity, it also increases, and the lateral head displacement, it gradually decreases. So this is what known as the mechanics part of the CASA. I'm giving one example. If I want to go from one part to the other, I should move in a straight line. And once a person is moving in a straight line, the straight line velocity increases, the linearity increases, the lateral movement decreases. So similar to that, a spermatozoa always tries to move in their track. And always we are in a state to calculate whether the spermatozoa is moving in a track or not. And what now I am showing you, these are some of the values which are required for your routine to routine interpretation of your data. If linearity is decreasing, it indicates sperm hyperactivity. That means sperm is capacitated. If the velocity of average path or straightness, they are increasing, it means it is showing that sperm is more competent and it can show the cervical penetrate and having faster motility. If the beat cross frequency or the oval is increasing, it means it shows that the flagellar beating is increasing and the sperm is capacitated. If the sperm ratio, fast motile to slow motile is 2:1, then it indicates that it is high motile spermatozoa. If circular motility is greater than 10%, then it is poor quality spermatozoa and this semen sample may be rejected. Usually it happens in the cryopreserved straws. Slow and local motile, if they are increasing, then it indicates that the semen quality is poor. If head activity parameter is increasing and it is very more, then it indicates the spermatozoa are very fast. If the straight line velocity, average path, straightness, if they are more, it means these are high fertile spermatozoa and they are having the fair chances they can achieve fertilization. If the curvilinear velocity and amplitude of lateral head displacement are increasing, then it indicates either the spermatozoa are undergone the capacitation or hyperactivity. If the VCL and ALH is increasing, yes, they are also showing this sperm hyperactivity. This is one of the data from our lab where we are showing that if you treat the sample with progesterone, which is a known inducer of fast motility, as well as capacitation, as well as acrosome reaction, it shows that you can see the spermatozoa population having the VCL is increasing in the progesterone treated samples. So this type of data out of a single sample can be achieved when we use a computer assisted semen analyzer, because these CASA, they give the picture of the entire population. So once I'm going to another part, this slide already I have explained, but let me finalize the concept with this master slide which I saw in my presentation earlier, that always a CASA values and kinematics, they depend on 3 parameters. Number 1, in which condition the spermatozoa are kept. Number 2, how the spermatozoa are processed. Number 3, what are the settings of the CASA to capture these values. Once at all these 3 values are being settled or being standardized by you, then they give the common values. It is, as most of the participants or students, I'm not sharing so much, but one thing is very clear, that kinematic data understanding requires understanding of this particular picture. This picture says that movement of the spermatozoa is not constant. Even if spermatozoa in a population, they move, they show the character in a population manner. And that's why it is very important to standardize our machine so that it can give us a correct picture what we are interested for. Rest of the things are my contact number is there, mail ID is also there. If you want any kind of information from the CASA, and I'm skipping so many things because CASA is a vast science. And this is our group. We are working. He's my mentor. She's my project staff. These are my laboratory staffs and laboratory students, rather I'll say. And these are my partners. And these fellows are my past partners who have made me to stand and to collect this information. So thank you so much. I'm very sorry for this internet issues. Otherwise, I have shown you another 1 or 2 videos. But anyways, if you are having any issue, you can ask me here, or you can share your views. Thank you so much. Now I welcome questions, whatever queries anybody is having, they can ask me. And if you can give me more time, then I can speak on kinematics more.
Yes.
Dr. Dilip,
Yes, sir.
please, you can you have still 15 minutes. You can, if you want to say something about your presentation.
Okay, sir. So the thing is that in this presentation, I have only kept 5-6 slides because usually most of the participants are students. So I do not want to make them confused. But for the faculty fraternity or the scientific fraternity, need to share some of the important things for which these CASA machines are actually essential in a laboratory. When we were doing the semen analysis earlier, usually we were dependent on a microscope with a phase contrast facility, and that is simply saying how many spermatozoa are motile. But the science says that as being seen as some population of motile spermatozoa, you cannot assess or evaluate the quality of the semen because there are multiple population of spermatozoa are there in a semen sample which are even not motile. Even they are in such a... Yes, sir.
Please share your screen.
It is, sir, shared.
No, it is not visible. Please, you can share it.
Actually, I am talking. I am not sharing anything.
Oh, okay. Then continue, please.
Actually, I am not sharing anything. Just I am continuing with this presentation.
Okay, please go ahead. Please go ahead.
Go with your face only. Stop your screen share.
Is it okay now? Am I audible?
Please continue.
Okay. So for that purpose, actually, we have purchased this CASA to give a value out of thousands, or you can say more than 1 lakh of spermatozoa you usually track. Why we track this spermatozoa? Because every CASA is integrated with that and we pull out the data. This is a very troublesome process. But daily we are doing what? Now we capture the images and we send the images into the system. We store them. Then we pull out the data, and from the data we select the subpopulations of the spermatozoa. And once we collect the subpopulation data, then we pull out how many number of spermatozoa are showing what type of character. And once the characters are being defined, then we classify the spermatozoa according to the populations. And these populations characterize us or give us information that how much of percentage of spermatozoa is really capable of fertilization, or they may carry out the process of fertilization. So need to say here one thing: standardization of the CASA solely one of the important factors. Second, once you get the data, you cross-match the data with already existing literature, or repeat the trials for several times. Once you repeat the trial for several times, then what will happen? Now the consistency of the data and variations in the data will not come out. So this is one of the fundamental features of the CASA analysis. Number one. Number two, number three, another important point is that once you are getting the kinematic data, do not interpret immediately that what data you are getting, you cannot integrate directly. You have to pull out at least the data of 50,000 to 70,000 spermatozoa to get a conclusive data, that is a cutoff value. And once you are getting a cutoff value, then only you can integrate that whatever the information I'm getting, then this is required for the further analysis. And last, I want to say, mostly CASA is useful in the analysis of cryopreserved spermatozoa. So lots of information are there in literature, but if you see laboratory to laboratory, even if person to person, also the CASA data are vary. So what we have done now, we are here not analyzing one straw or two straw. Rather, we can continue randomly around 10 straws or 20 straws from one sample, and at least 2,000 to 3,000 spermatozoa we capture. And out of that, we analyze the field continuously. And if a field is giving either a very high value or very low value, then we delete that particular field. And every CASA is having equipped with this particular point, that they either include that data which is very high or very low. So there are so many things are there to discuss. If anybody is having any query, then they can ask me, or anything they want to know about the CASA, then I am having my number, my email ID is also being there. You can ask me any of the queries, then I can help you out. Thank you so much.
Thank you.
Thank you, Dr. Dilip, for a very good lecture, but we are sorry that there are some technical glitches, so we could not see your videos properly. We are very sorry for that.
No issues, sir.
Meanwhile, I take this opportunity to thank you on behalf of organizers, College of Veterinary Science and Junagadh Agriculture University, and NAHEP, IDP, under which this training has been organized. Thank you for your effort, and thank you for your very informative lecture. Thank you very much.
Thank you, sir. If any no queries there, then I should leave this.
Yeah, please, we will send you by email if any queries from student we will receive.
Okay, sir. Thank you.
Thank you very much. So now we move on to the today's last lecture, and that also
जैसे निकली है
so okay, so we are about to start last lecture of fourth day of this training part, and I am happy to welcome Dr. M.T. Panchal, who is working as a professor at the Department of Gynecology, Anand Agricultural University, Anand, Gujarat. And he has completed his BVSc, MVSc and doctorate degree from the erstwhile Gujarat Agricultural University. And he has started his career from veterinary officer to currently is working as professor at AU, Anand. He won many awards, to name a few: Dr. G.B. Singh Memorial Award with silver medal for best research paper, and also he won Outstanding Young Scientist awards. Now he has guided about 13 PG students, and he has worked on about 11 research schemes. He is associated with 11 research schemes, mainly on the cattle infertility scheme and central sperm station scheme. And he also regularly giving his expertise on clinics, and he has delivered radio talk, TV talk a number of times. And he also served various capacities as hostel rector and editors and co-editors of various journals. Sir has published about 100 papers, including books, popular articles, and research papers in international and national journals. And he has presented his research papers, about 68 research papers, and he also attended various trainings, seminars, symposiums. With this brief introduction, I would like to invite and request Dr. M.T. Panchal on behalf of Veterinary College and Junagadh Agriculture University to deliver his lecture. Thank you, sir. Please, floor is yours, sir.
Am I audible?
Yes, sir. Please, sir.
Okay. Very good evening to my best friend and respected Dean, Dr. T.N. Tang, Dr. P.S. Tang, Dr. Wala, Organizing Secretary, Dr. Sharma, and dear participants, as well as the learned participants. I'm here to talk on the rare topic which is not routinely being dealt with. I remember when I was studying, we were not having any idea about immunomodulation of the reproduction in small animals and even in the bovines also. So now we have started touching to this area of the research, then the technology and all those things. Before going ahead with the topic, I may have some words of apology for having getting the things better in the morning, and still I do not know how this net will cooperate with me. But let us hope for good and let us go ahead with the topic itself. So,
Sir, please unmute yourself. Hello, sir, please unmute yourself.
Panchal sir.
Hello, sir.
am I audible?
Yes, please, sir. Please, sir.
Okay. So this particular livestock contributes a lot to the Indian economy, and production is fully dependent on reproduction. And friends, we know that reproduction is a complex and the essential process for production, which is being governed by a lot of physiological events. But we should not forget about the environmental effects on this reproduction. So primarily, we know that reproduction is controlled by hypothalamus-pituitary gonadal axis, and very well we know the hormone like GnRH, LH, FSH, estrogen, testosterone, and inhibin. All those hormones are being, controlling the reproduction. But we have been talking all the while GnRH, LH, FSH, estrogen, progesterone, testosterone, but least possibly for inhibin. And optimizing this reproduction efficiency in the female animals is rather simply can be possible through the thorough understanding of the seasonal effect on the reproduction. And then one more thing that which is being added to is the fecundity. Now, friends, this inhibin is a non-steroidal glycoprotein hormone, and it has got major action of down-regulating the FSH secretion from the intrapituitary through the negative feedback control to have the recruitment of the primary follicles to allow the fixed number of ovulations to take place, characteristic to the species. And this is what we call is fecundity. We call as fecundity, right? Now, the enhancement of this ovulation rate in the animals is usually controlled through the hormones like FSH, PMSG, GnRH, interferon, and even supplementing omega-3 is they have already been found to be a useful tool for increasing number of young ones born. But alternatively, we can have one more scope to go for increasing the rate of ovulation through the use of the basic knowledge of inhibin, where we have to go for immunization of the female against inhibin, so that as the word itself indicates, inhibin, which has got inhibitory effects on the production of the FSH, that can simply be controlled. Now, historically, if I briefly touch to this part, in the year 1920, Motaram and Kramer were the first person to discover the soluble factor secreted by the testes and regulated the pituitary function. Now, in the year 1932, there was the first evidence of testicular non-steroidal factor that abolishes, that has got ability to regulate the function of the pituitary. And they thought that administration of this aqueous testicular preparation to the castrated rats was able to restore the physiological characteristics of pituitary cells that had been altered after castration. And these people, Ron McCullough was the first person to give a word, what we call inhibin, as a bioactive factor. Frank de Jong and Richard Sharp in the year 1976 in Edinburgh, UK, discovered that the fluid from the cow's ovarian follicle has got high amount of the substance which has got potential to suppress the FSH secretion. Miyamoto and co-workers 1985 and Robertson co-workers 1985 were the persons who first isolated this inhibin from the porcine and bovine ovarian follicle fluids. So, how this FSH regulates reproduction? So, FSH is a key hormone that basically functions the recruitment and the growth of the follicle during estrous cycle, and the periodical fluctuation of FSH prior to the coming up of the follicular wave itself indicates that FSH has got primary growth. And particularly when the luteolysis is being induced, there will be always stimulation of FSH that will be resulting into the follicular growth, and parallelly there will be increase in the production of inhibin and estradiol 17 beta by the dominant follicle. And this particular growing cohort of the follicles altogether, and this ultimately results into suppression of further FSH level. Now this results into atresia of the subordinate follicles. This is very important mechanism that nature has provided to the female, that in no cycle the female must fail to have at least ready one follicle for ovulation in the monotrochous species and multiple follicles for the polytrochous species. However, the follicles which are being recruited, they are always higher in number than the required number, and they do support the growth of the dominant follicle. But the subordinate follicles, they undergo the atresia, and they are not allowed to grow further. So primarily, again, coming to physiological role of inhibin produced by the follicle as they develop from the small follicles to pre-ovulatory stages. This follicle turnover continues throughout the estrous cycle in a wave-like pattern in domestic animals. This is very well known fact now. Now, emergence of each follicular wave is preceded by elevation of FSH in the blood circulation. So, circulating FSH level after the selection of the dominant follicle through negative feedback effect, it inhibits the other developing follicles. So, it's a very magical phenomenon, which is, has to be understood well. Now, inhibin predominantly expressed in the testicles, especially from Sertoli cells and over your granulosa cells and theca cells. And the follicular fluid has been found to be rich source of the inhibin. So, folliculogenesis and spermatogenesis both are regulated by this inhibin through the endocrine as well as paracrine and autocrine actions. And inhibin exerts through its negative feedback on the FSH at pituitary gland level, and it affects ultimately the gonadal function. So, along with the selective control of FSH secretion, inhibin has got paracrine, ovarian, and testicular regulatory effect, as well as role in the uteroplacental unit, a promising marker for male and female infertility. But we won't be touching to this part today, so far as today's discussion is concerned. In vitro studies have indicated two separate types of actions of inhibin. Inhibin at a lower concentration suppresses the release of FSH and synthesis, and at a higher concentration, this inhibin acts on pituitary gonadotrophs, and the content of these gonadotrophs for FSH and LH production goes down due to degradation of these intracellular stores of these hormones. So this is again a schematic diagram where can simply we have a look to this, that basically this is known, very well known fact, and we have been always talking about GnRH, and then the GnRH stimulates hypothalamus, this pituitary, and there will be production of FSH and LH. And these gonad will be producing, along with estrogen and progesterone, these three active hormones, this inhibin, activin, and follistatin. As this name suggests, activin has got activating effect, inhibin has got inhibiting effect, and follistatin has got effect of bringing about static condition of the follicular growth. So the same thing is being governed through the hypothalamus, then pituitary, and then the expression of GnRH at the level of the pituitary, and that stimulates production of FSH and LH. This activin from the anterior pituitary has got paracrine effect on the gonadotropes and can induce FSH expression and the release of the FSH. Now, granular cells of an internal follicle secretes inhibin, and this inhibin acts on anteropituitary in an endocrine manner, and inhibin be produced by the gonads will antagonize action and give the negative feedback to FSH and regulate the HPG excess. Now, this is the summary of what I have been telling you, that the hypothalamus stimulates pituitary. Pituitary will be acting on the gonads. There will be formation of the follicle and then the LH both. And at the same time, there will be production of this inhibin. So this inhibin acts on the ovary. At the same time, this inhibin acts on the pituitary as well as hypothalamus level. And that brings about the primarily what we call the separation of FSH and LH, but primarily FSH, not LH. Now, this is again a schematic diagram, which is very much useful for understanding the basic phenomena of follicular wave theory for undergraduate students as well as for postgraduate students. What happens that multiple number of follicles are being recruited from the ovarian follicle. And then these multiple follicles being recruited, few follicles they develop further and remaining they undergo the process of atresia. So these small follicles will be still elaborating the estradiol. And these follicles they further grow. Out of these follicles being selected, what is being called from recruited to selected follicles, again few undergo the process of atresia, and out of this few, still few remaining will be growing further. But the interesting phenomena is that there will be increasing concentration of estradiol secreted from the recruited follicles, then selected follicles, and the follicles which are being further selected to become dominant follicles, still depending upon the fecundity of the animal. The other follicles still they undergo the atresia. And the follicle which is supposed to ovulate at the forthcoming estrus will be developing further what we call still the fullest growing or maturing follicle. So at this particular point of development, the inhibin which is being produced by this growing follicle, if we can neutralize it during luteal phase, which produces the hypersecretion of FSH, with an associated the stimulation or follicular development. And this indicates that inhibin is an important factor for negative regulation of FSH during early luteal phase when the production of progesterone is high. So in the follicles responding most rapidly and extensively to FSH, by middle of the luteal phase, the aromatase activity in the granular cells and inhibin production as well as expression of LH receptor will be reaching to the critical level. And this will result into the LH receptor development, and this follicle is selected and that becomes destined to ovulate follicle. Now, during the second half of the luteal phase, this inhibin production in the period of follicle continues to increase, paralleling aromatase activity as well as estradiol secretion. So, by natural luteolysis, or even if you go for the induction of lysis of the corpus luteum through use of PGF-alpha, yes, the FSH in both the cases comes in the picture, stimulates the follicular growth, resulting into an increase in the inhibin and estradiol production from the dominant follicle, and this particularly leads to reduced peripheral FSH level. And this results into separation of subordinate follicles from the same wave of recruited follicles. Now, this has been again simplified, and we will be just trying to have a look to this figure, that after the follicles they have been recruited under the effect of FSH, they grow further, what we primarily call them as small follicles. Out of them, few follicles will go in atresia, but at the same time, they produce inhibin. And this inhibin will be bringing about the drop in the level of FSH. So this FSH is not available for the follicles which are supposed to undergo atresia, but still the follicles which have been selected for further growth to become a selected follicle, they do grow. So this growth is limited to only the selected follicles. Now at the same time, there will be the LH receptor being produced, And these follicles, they respond well with the aromatase activity. Out of selected follicles, still some follicles undergo atresia. They still continue production of inhibin and suppression of FSH production. But still, again, they have the production of LH and estradiol production will continue. And the follicles which grow as large follicles, dominant follicles, again, at this last stage also, the follicle which is not destined to ovulate undergoes the process of atresia. And the follicle which is supposed to ovulate only allowed to have the final growth and to become ovulatory follicle. So the interesting phenomena over here is that the follicle which is acting or existing as dominant follicle suppresses the development of the remaining follicles. So in the cattle, physiologically, even in the goats, I mean the small and large ruminants, there is an inverse relationship exists between FSH and inhibin, which was demonstrated indicating a key role of inhibin produced by dominant follicle in the terminating the transient peak of FSH secretion. A highly significant inverse correlation between inhibin A and FSH, and highly significant polycorrelation exists between inhibin A and estradiol. What we mean to say that when the inhibin increases, FSH goes down. At the same time, when the inhibin is rising, there will be always rising level of estradiol from the follicle. Now, this is because of the rising mean concentration of estradiol from the follicular phase and reaching peak at least 2 to 3 days before the ovulation takes place. We very well know this basic phenomena of how the ovulation is triggered through the release of LH surge with a rising level of estrogen in the proestrous period, culminating into the estrus when the animal reaches exactly into the optimum phase of estrus. So this fact indicates that the follicles increase the secretion of inhibin A as well as estradiol 7 beta during final maturation in the ruminants. So there is a unique phenomena in the secretion of inhibin so-called as ovulatory inhibin surge. Formerly, we used to talk about only the LH surge. Now, scientists have started using this word ovulatory inhibin surge during the estrous cycle in the farm animals. So, circulating inhibins, but not this estradiol beta, sharply increase on the day of ovulation in the mares that has been found. And that suggests usefulness of circulating inhibin levels for determining the time of ovulation, even in the farm animals. This can be very good applicability of applied utility in the future days to come. Now, coming back to inhibin family and the structure, basically it is glycoprotein belonging to transforming growth factor that is called as TGF-B superfamily. It is heterodimer molecule composed of two dissimilar units of 134 and 116 amino acid residues, which are being designated as alpha and beta respectively, and they are linked by the disulfide bonds. So dimerization of these subunits leads to formation of different type of inhibins, particularly inhibin A and inhibin B, in which the alpha subunit is common and it is linked to either beta A or beta B subunits. So this will give rise to formation of either inhibin A or inhibin B, and still there is inhibin AB also. So these particular inhibins are produced primarily by gonads, which are processed into diverse array of different molecular masses of alpha beta dimers and free alpha beta subunits. So like other members of transforming growth factor B gene family, they undergo processing from a larger precursor molecules and still they assemble into the functional dimers also. So this is briefly I have tried to show you the structure regarding dimerization of alpha and beta subunits leading to two forms of development of inhibin and inhibin B production, having this alpha being a common unit and B A and beta B subunits. And still we have alpha activin AB, which has got both the units. So likewise, this inhibin is being produced. Now, inhibin is, particularly inhibin family is comprised of three non-steroidal glycoprotein hormones. As I told you in the schematic diagram of SPGXs, inhibin, activin, and follistatin. Out of these three, inhibin and activin belongs to transforming growth factor B superfamily, which mediates the embryonic growth and the development. Of course, the follistatin is not a member of this TGF-B superfamily. Now, this TGF-beta ligand are initially synthesized as precursor proteins that undergo proteolytic cleavages. Mature segment from the dimer via disulfide links, which serve as active molecules. So, subunits alpha, beta A, beta B can be processed in several ways to produce different isoforms. When we are talking about inhibin, we will have to have this alpha, the anti-inhibin, which can be manufactured in the laboratory. So various combinations of alpha and beta subunits appear possible, giving rise to a number of different dimeric inhibin forms. Research has given information that multiple types of the bovine follicle fluids are having the isomers of the multiple kilodaltons of their molecular weight. Now, two major forms of inhibin have been found in the buffalo follicular fluid with a lethal proteolytic cleavage or processing of a larger precursor. So within this TGF-beta superfamily, it is worth to note over here that there is an agonist and antagonist relationship between activin and inhibin, which is unique and critical to integrated reproductive function. So activin acts at a pituitary level to stimulate FSH and LH, and this can be antagonized by endocrine activity gradually during inhibin. So this is again, we can just see the inhibin A and inhibin B over here, which has got alpha weight as common and beta A and beta B, these subunits, giving rise to formation of inhibin A and inhibin B. And then we have three types of activin A, activin AB, and activin B by these different units, where activin A has got both two units of beta A and beta A. Here it is beta A and beta B. Here it is beta B and beta B. So these both the units are of same type. Now, how this inhibin actually acts? So inhibin A and inhibin B both suppresses FSH without affecting LH in the same cells. So two groups of binding proteins, they are involved for the action of this inhibin, called as type 1 and type 2 receptors, which can bind weakly or strongly to the respective transforming growth factor B superfamily members. But the combination is critical to transduce a signal, what ultimately the product accordingly that binding should take place. So the two proposed models have been there for the action of the inhibin. Namely, the first model indicates the competitive binding of this activin and inhibin to this beta receptors in the activin type 2 receptor. And when they are, say suppose when activin binds, then there will be activation of the follicular growth. But when the inhibin binds, then particularly the subunit of this beta unit will be non-functional. And this will be resulting into inhibition of recruitment of the follicles. So through that way, how these follicles being recruited are suppressed so far as their further development is concerned. In the second model, this inhibin binds to the inhibin preferring type 2 receptor instead of recruiting type 1 receptor, and then there will be inhibitory effect, and there will be an enhancement of inhibitory SMAD for the action of activation of the totally dependent pathway. So this the way how both these models have been proposed for this action of inhibin. There is third protein that is being called as accessory protein known as beta glycan, has been said to be having a role of enhancement in the interaction of inhibin with the receptors in both the models. Beta glycan can enhance inhibin sensitivity in all the cells that normally respond poorly to inhibin. So beta glycan functions as an obligate co-receptor for inhibin A, but not inhibin B in the gonadotrophs, or even some of the other proteins which may work instead of beta glycans to bind with the inhibin B in the mice, but still it is not mature. Now, coming back again to our basic phenomena, how this entire knowledge of inhibin, its mode of action and then functioning is helpful to us. So, inhibin, as we have already discussed, acts via pituitary to have the inhibition synthesis, the synthesis of FSH being inhibited, and there's a reduction in the endogenous inhibin secretion, which ultimately results into increased FSH concentration. I may recollect the figure which I showed you, that with the growth of follicle, there will be increased production of inhibin, suppressing the FSH. Right? Now, through any ways and means, if you control this inhibin release, then there will be proportionately in the refractive reaction, there should be rise in the level of FSH. When the FSH level rises, yes, it offers potentially an increasing number of ovulatory follicles in the ovary. So, inhibin-mediated pathways found to be potential alternative methodology for superovulation. Ultimately, our purpose of superovulation is to stimulate the ovary through exogenous source of the drugs like, hormones like GnRH, FSH, PMSG, and so on. And this ultimately brings about the FSH release, resulting into increased rate of ovulation. Here we are talking about either deactivating the inhibin or nullifying the effect of inhibin, so as not to allow it to have separation of FSH release. Yes, ultimately the FSH release will be there, resulting into increased production of the increased rate or number of the follicles being selected for further growth, resulting into increased number of ovulation, which is a simple outcome comparable to the phenomena of superovulation. So, understanding of the physiological role of inhibin is very, very important for us, and development of inhibin-based immunogens for fertility enhancement in animal has been the new area, which of course cannot be called as too recent, but still we have not gone into much of the depth of this particular area. So, immunization of the animal against inhibin is useful method for inducing multiple ovulation in farm animals. So, different type of the inhibin-based immunogens are actually available. Rather, they were already used by the different scientists. Namely, they had used this follicle fluid, of course, steroid-free, native or purified inhibin, synthetic inhibin alpha peptides, and recombinant inhibin alpha subunits also. So they have already tested them through the research, and they found, yes, it do help us for the increasing rate of ovulation. So they have used this bovine follicle fluid in the sheep and ovine follicle fluid in the sheep and cattle as an immunogen to achieve the higher FSH level, resulting into ultimately higher rate of ovulations. Not only this normal natural follicle fluids, but synthetic peptides based on the specified amino acid sequences have been found to be immunogenic, and they work as potent immunogens. Say, for example, bovine inhibin alpha 129 tyrosine 30. This has been used to achieve a higher ovulation rate in the sheep and cattle. Even in the porcine inhibin alpha in the goat and cattle has yielded positive results. So, increasing the rate of ovulation by at least 3 to 5 folds has been found in the ewes immunized against recombinant bovine and human inhibin alpha subunits, fuse and proteins. So, isolation of this inhibin from the natural sources, yes, it can be used, but it can be used for production of limited quantities of the bioactive protein. So, alternatively, we can have recombinant DNA technology, which provides a very good tool for production of recombinant inhibin on large scale in the suitable host cells. Now, again, coming back to inhibin, which has got suppressive effect on the FSH for the follicles. Active immunization of goats and cattle against inhibin resulted into significant increase in the rate of ovulation. Now, they say that this effect has been attributed to stimulatory effect of inhibin immunoneutralization on the ovary, either endocrinologically by removing inhibitory effect of inhibin on the FSH secretion, or locally through a paracrine effect. And finally, results into enhancement of development of the ovarian follicles with an increasing number of growing follicles. I'm just referring to such research reports over here. Cattle injected intravenously with the injection of 25, 37.5 and 50 milliliters of inhibin antiserum had resulted into multiple ovulations, particularly 2 to 4 in the 50 ml group. Even the rate of blastocyst development for animals treated with 50 to 200 microliters of inhibin antiserum had significantly higher than the control animals. Oocytes induced to superovulate using immunization against endogenous inhibin have normal development competence also. So either passive or active immunization of a female against inhibin could be used to induce superovulation. Still, immunization against inhibin in combination with the conventional superovulation protocols have been reported by certain research workers. If we can have a look at this active immunization of the cows against inhibin reported by Takedomi and co-workers 2005, we can see here this is entirely control group and this is entirely the treatment group, where they had used this inhibin immunized group along with the vaccine, inhibin vaccine and the FSH. So we can just see here we detected number of CLs, ova or embryos recovered and transfer embryos found have been found to be significantly higher than the control group. Itself indicates that the active immunization of the cows against inhibin has got always advantage over the untreated groups. Active and passive immunization of goats against inhibin as reported by Sasaki and co-workers 2006, wherein we can just see the rate of ovulation, number of follicles, and even number of CLs. We can just see passive immunization had the higher rate of number of follicles and ovulation rate as compared to the control group. Even the active immunization has resulted into higher number of this corporal lutea being found, follicles, and the ovulation rate found as compared to the plain group. Enhancing embryo yield in superovulated offspring frisians differs by immunization against inhibin has been also reported, and we can see over here that the total embryo yield in inhibin immunized and control groups has been found to be nearly double about. Total transferable embryos again significantly higher, not significantly but apparently higher. Then the grade 1 embryos were also found to be higher in the inhibin immunized females as compared to the control. So likewise, we can say that there has been always beneficial effect. There is another study of fecundity of Iraqi Awasi eaves immunized against the inhibin as reported by the Al-Sai Hadi and co-workers 2018, where they found that when the eaves were either had a negative group, positive control group, then synthetic inhibin alpha subunit which was given in this SI unit, and then the steroid-free bovine follicular fluid was given in the fourth group. And if we just try to see the results on the basis of their performance, that the eaves which had this inhibin alpha subunit being given and the steroid-free bovine follicular fluid given had significantly higher rate of embryos as compared to the control groups. So immunization of the eaves against the endogenous inhibin had a positive role for increasing of FSH secretion, ovarian follicular development, and the rate of ovulation. Even the maturation of oocyte and pathogenic activity in the porcine embryos have been found to be benefited through the use of anti-inhibin alpha subunits in the maturation medium as reported by Ann and co-workers in 2015. And we can just see here that the maturation rate, ovulation rate, then the cleavage has been found to be beneficial in the group of 50, 100, and 200 dosage of antibody as compared to when no antibody was given. So there are certain other additional reports wherein Ratter co-workers 2015 evaluated the influence of active immunization against inhibin in the camel, and they found that active immunization against inhibin may provide sufficient method of enhancement of urine activity, and even they say that the seasonal anistus issue even in the camels can be overcome through the stimulation of onset of breeding activity prior to breeding season. Baharaledin, Ali and co-workers in 2015 investigated stimulating ovarian follicle development in order to improve the fertility in water buffaloes by immunizing against inhibin. And they found that immunization against inhibin coupled with treatment with ovacing protocol can constitute a new technique to increase fertility in the water buffaloes. Wei Zhen and co-workers in the year 2017 again tested the efficacy, biodistribution, and safety of inhibin DNA vaccine delivered by attenuated Salmonella fluoresceus, and they found that inhibin DNA vaccine delivered by these organisms was safe, and this vaccine had a potential mean to improve the rate of reproductive rates in primates and the other animals. Lee and co-workers 2017 examined biological effects of immunoneutralization of inhibin bioactivity in porcine granule cells using transcriptome profiling by RNase sequence technology. And they found that a total of 476 genes, including 27 novel genes, were differently expressed in anti-inhibin antibody-treated granule cells compared to untreated granule cells. And they said that treatment of granule cells with anti-inhibin alpha surrogate antibodies increase both cell proliferation as well as extravascular secretion. So, coming to an end of my this small talk, there are still multiple limitations being found and reported by various authors, where they say that immunization against inhibin in the male and female increases offers a secretion with no significant change in the LH. Now, perhaps it is being thought over that when multiple ovulations are taking place, I mean, multiple follicles are being developing, it can be possible that perhaps there could be a need of LH additionally required for ovulation to take place, as we have been perceiving even in the superovulation and synchronization protocols. In addition to the classical endocrine feedback role of inhibin molecule also subsume local actions at intragonadal level, which can be a point of concern and still requires in-depth study. Considerations must be given to natural fecundity of species or breeds, whatever being subjected to immunization process, because little to be gained by artificially raising the litter size beyond the optimum. Yes, nature has divided fecundity according to different species, and we are increasing the rate of ovulation and number of litter being born. And will it be against the nature, or it is we are compromising to the natural preponderance? That one has to look into. So maternal behavior and milk production have to be also adequate to raise extra litter when we talk about increasing number of ovulations and the number of litter born. So as with other approaches to increase fecundity through the prevailing routes of genetic selection and even the gonadotropins treatments, etc., increased ovulation rate resulting from inhibin immunization may have a detrimental effect on perinatal survival owing to decreased birth weight. That one has to look into. So finally, summarizing the discussion, inhibins are multifunctional molecules involved in the control of the pituitary emphasis secretion. They are glycoprotein hormones produced in gonads and are capable of regulating FSH secretion by the pituitary gland. Inhibin shows a reciprocal relationship with FSH during its cycle. Immunization against inhibin enhances FSH secretion and follicular growth, and finally increases the ovulation rate. Different studies on inhibin for increasing rate of ovulation and fecundity in animal opens a possibility of eliminating the use of exogenous gonadotropins for fertility enhancement. So there comes an end of my presentation, and at the end, I would like to thank the organizers for having been given me this chance to share my thoughts and views on the applied topic of using inhibin for the immunomodulation of the fecundity in the small as well as large ruminants. Thank you once again.
Thank you very much, sir, for sparing your valuable time and giving your lecture on immunological modulation of reproduction in small animals. We have received a request from our students that if you can share your presentation to organizers, they will send to students.
Definitely, I will send you this my presentation through the email, right?
Please, sir. And one question is, that is there any product available for inhibition, the immunization in small animals?
May I request you to repeat the question, please? May I request you to repeat the question, please? I'm not getting my good work from my laptop.
Is there any product available which can immunological modulation of reproduction in small?
No. As on today, no any marketable or proprietary product is available.
Okay, sir. So, sir, once again, on behalf of organizing committee and Dean Dr. P.N. Tuck from Veterinary College, Junagadh Agriculture University, and NAHEP IDP ICR project, I would like to thank you for sparing your valuable time and enlighten us on this topic. Thank you very much, sir.
And also, I want to
Thank you, Dr. Wala, thank you, Dr. Sharma, and all other friends and the entire team for having been created a little bit inconvenience because of disturbances and all that. But anyhow, again, still I thank you again, once again.
Okay, thank you.
Thank you, sir. And I also would like to thank my reporter, Dr. Nilima, for sparing all day here, and all other organizers for giving me opportunity to moderate today's session. Thank you very much.
And also want to thank all the panelists who remain present over here on this online platform and spare whole of their time to give us the very informative feedback. And thanks again to all, one and all. Thank you.
Thank you. Thank you.
Thank you, sir.